Okay. Let's call to order the Carroll County Commissioners meeting of the 11th of September 2019. Would you join me in the pledge, please? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
That would be it. Forgot to turn my phone.
Now I kind of thought it might be the Star Spangled Banner.
Madam Chairman, would it be appropriate to have a moment of silence given the date? Is it on there? Oh, okay.
It's
Sorry, I thought
It is.
I'm behind, sorry.
Let me see. Do you need time to get hooked up?
No,
Or
I'm finding myself in
you
there.
want to move over to the warm side of the room?
No, I'm good, I was, thank you.
I'd like to have a moment of silence for the 9/11 victims on this 18th year anniversary, please. Thank you. May I have a motion on the September 14th minutes? Second.
Second, you mean September 4th, right?
September 4th, I'm sorry. The motion's been made and seconded to accept the September 4th minutes. Are there any additions or corrections?
Yep.
Yes, David?
Hayfields. I think that we decided that if we were going to do whatever the individual wanted, that we would charge them $30 a bail.
I believe you're correct. That was a quick estimate, and we
Yes.
said that we would take that as a beginning figure.
Yeah, and I think that ought to be in the minutes.
Any other additions or corrections? No. I will just add that. So I will just say suggested. David, is that all right?
Sure.
Suggested $30 per bail. So I corrected it to say county feels and what the charge per bail might be. It was suggested $30 a bail.
Yep.
Any other additions or corrections? All those in favor of the minutes as amended, say aye. Aye. Those opposed? I think we should probably initial that. Let's initial that addition here. Are there any media questions? Are there any public input? The check manifest approved for the week ending the 6th of September 2019 was $118,144.47. And the first thing on the agenda is the jail trash dumpster. So Bob and Jason, I guess that's yours.
Good morning.
Sure.
So I asked Bob to look into the possibility of a dumpster for the jail, and I'll give you a backstory. Currently, we don't have a dumpster, and what we do is the trash is taken from the kitchen and put into this room right outside, attached to the jail right outside, where bags tend to leak and break open because they're handled from us to there, from there, in the back of the truck, from back of the truck over to the dumpster at the nursing home. And as it is, we buy the most expensive trash bags we can to try to have it from not spilling because there's a lot of slop inside of them. It is a sanitation issue during the summertime, especially with the heat stuff, along with biohazard stuff, especially with Hep A that is transferred through fecal matter, which transfers into food. Food is one of the biggest ways that it can be transferred. This past year, we had some bags spill open, including on some of the young lads that were hired to mow the lawns this past summer. It has come time that we need to have a dumpster over there so the trash can be just thrown in the dumpster and then picked up and taken away to be disposed of. So with that being said, I had Bob take a look into it, and it's going to cost us a little more on our sanitation, and I'll turn that portion over to him.
Yeah, the way the trash is handled now, it's handled 4 times before it makes it into the dumpster, and this will reduce it to 1 time, taking a lot of that movement cost and hazard out of the picture. So I was able to contact our waste management vendor, and they had originally given us an estimate of $515 a month to add a dumpster on, and then I talked to them and explained that we have an overflow dumpster on site that we could use, and we're not going to be increasing any waste load into the waste stream. We're just taking the trashes, the jail's trash, and putting it in dumpster B rather than the compactor. It's no additional trash, so we negotiated a price down to $300 a month, and that seems to be acceptable with Ken and Jason, but that adds roughly $3,300 onto our annual trash budget. But in lieu of the safety and health risks, I think it's worth it. I think we need to do this.
Are you going to move the overflow dumpster down there?
Yeah.
So what about the overflow?
When I need it, we'll just take it a little bit further. Every once in a while, on holidays, on rare occasions, when our pickups at the compactor get bumped up a day or two, we run out of room and we have to use the overflow dumpster.
Ken?
But because you're not putting the jail's trash in there, you won't be utilizing the overflow dumpster.
No, but the reason that we had the overflow dumpster, it was actually a freebie. They gave it to us because I barked that we had problems on holidays, overfilling, and part of our agreement was that they would give us an overflow dumpster at no charge. So we've been using that, and on holidays we do. Every once in a while we throw trash in there. We've used it for other things in here. We just pay for individual pickups when they come. So by utilizing this dumpster that we already have on site, we don't incur any delivery charges for them to bring up a dumpster for us. We just have to pay the charge for them to drive over and dump it. They're not charging us any tipping fees for the trash because we've already paid for it. So it's just a delivery charge.
Well,
Or pickup charge, excuse me.
my question is, the bulk mass hasn't changed any.
Correct. That's why I was able to negotiate it from $515 a month down to $300 a month.
But why wouldn't it be $0 a month?
Because they have to pay a driver to go over there and pick it up. It's their business, they have to make money doing something.
Well, they pick it up
No,
where it is now, right?
Right, with one trip. They drive into the truck, the dumpster, they pull it out, they dump it, put it back, drive off. Now they have to do it twice, so they're just charging us to go over to the jail and dump.
But I'm confused, yes.
is it the same, because the compactor truck's different than the tipping truck, isn't it?
It's the same truck.
Oh, it is, okay.
Yeah, it'll be the same truck. They're not charging us any tipping fees, they're just charging us the delivery charge to have the guy drive over there and pick up the trash from the jail.
David, do you have a comment?
Yeah, I find it pretty expensive to charge us $300 a month to back a big truck up and hook it up, and 2 seconds it goes up and unloads into the crusher, and that's it. I'd like to see you go to Caselli and see what they do to pick up. We're only talking about one. But yeah, that would cause problems, because then we'd have to pay a tripping fee.
Tipping fee,
That
yes.
wouldn't work.
That-
I just think it's a lot of money to drive 50 yards to back up to a dumpster.
But they've already drive from the nursing home dumpster over to the overfill dumpster, right?
No, only on demand, not on a regular basis. This is nothing that we're asking them to do to provide an additional service.
Okay, how often are you expecting this to be done?
We're gonna start with once a week and see how that goes. If it turns out that we can do once every 2 weeks, they'll cut it in half. But we have to start somewhere.
David?
Bob, have you, Jason, have you looked into, what is it gonna be, a 10-yarder?
It's 10-yarder.
Why don't we look into purchasing our own 10-yarder and having them pick it up?
It's just,
Because we'll have to pay to rent that.
No,
rent that-
No.
it's free.
Right.
It's free. The 10-yarder is free, right?
Well, right now it is, because as a courtesy, but we are asking them to provide an additional service above and beyond our
Well, maybe
original
that's my
contract.
confusion. What are we asking them to do above and beyond what they're doing now?
Instead of, we're converting this, this dumpster that they haven't charged us for into an actual service.
How often is that dumpster dumped?
Right now, only on demand.
Which is,
It could be, how often we use it, maybe once a year, once or twice a year, really.
but every time they come to pick it up, they charge us $225.
Right,
So it's not free, it's not like they do it for free.
they just
oh,
let us
that
sit,
was the missing piece, Bob. You
they just
didn't-
let us sit here, they don't
Right.
charge us rent.
But they didn't, and
Sit
they're not
here.
gonna charge us rent if it's over at the jail.
Well, they may be including it because we're asking them to actively use the dumpster now.
So what Ken is saying, when we dump the dumpster, it's a $250 charge,
$225, yeah, that's right here.
$225.
Yeah,
So, and if we do that 12 times a year, it's 12 times $225.
right,
What you're now saying is you're going to ask them to dump it 52 times a year.
right,
I see.
right.
And now instead of $225 though, they want $300.
Well, no, that's $225 per with tipping fees. Now it's just gonna be a $75 per. 75 times 4 is 300, because there's 4 weeks in a month.
Okay, gotcha. Now that's better, because I can understand $75 versus $225.
Yes.
And that's, you call that tipping.
Yeah, tipping is the cost of the actual waste being disposed of.
Okay.
So they're actually just charging us to drive the truck over and dump it 4 times a month for $300.
Okay. Question, Ken, I guess this may be for you, is this going to go on the House of Corrections
Yeah.
budget?
Mhm.
Or on,
The House of
Babson.
Corrections budget.
you have money in there for that now?
We'll have to transfer some money off fees and services, but we have money to cover it for the rest of the year, yes.
When do they want to start this?
As soon as you sign the contract, we'll move the dumpster from where it sits now over to the jail and start using it immediately.
David?
Yeah, Bobby, Jason, is it single stream or do we have to separate?
Single stream.
Single stream, yeah. We don't,
The only recycling we do is cardboard, and we have a separate cardboard dumpster at the nursing home for that. But, this dumpster will take everything.
Okay.
Shouldn't be all food waste though, isn't it?
Well,
no, it
It's
could
a
be.
mix, it's a mix.
It'd be plastics,
Yeah,
wrappers, Coke bottles, whatever.
things that break.
We separate out our aluminum cans?
No.
They don't use aluminum cans, I think. I mean,
We don't have any.
Yeah, what am I thinking? Right.
No.
The only thing would be to separate the plastic.
but there's an additional charge for us doing that. We pay extra for cardboard and
We pay extra for cardboard.
yeah.
Why, because it's a dumpster?
Yeah, it's on our waste management contract.
Yeah.
Well, I don't have the waste contract in front of me, so maybe you could explain it.
We pay recycling for that cardboard dumpster. We pay a rental fee, we pay a pickup fee, and we pay a small tipping fee. It costs less money for us to dispose of the cardboard than it would be if we put it in the trash, because they recycle it. It still costs us to get rid of it, but it costs us less because it's a recyclable.
That's ironic, since it's one of the two products you can still get money for as a trash hauler. Make a motion that we accept the request for a 10-yard dumpster to be placed at the jail and used by the jail. Oh, you don't have to put used by the jail, but placed at the jail.
Moved. You want to move our dumpster there.
Okay, move the dumpster.
Because it's not a new one, right?
Right. No, we're gonna move it ourselves.
One of those.
We have a backhoe with a forklift on it. We're just gonna pick it up and move it over, plant it where we want it. We don't have to pay waste management to do it.
Okay, I will second that. Any more, is there discussion? Tara?
Fine.
Would you also authorize the chairman to sign on that motion?
And include in that motion, please, we authorize the chairman to sign.
I have one thing here. I did want to, I see it on here now. This is $300 a month, but it says nothing about 4 pickups a month.
It does. If you look just to the left of the, it's in the same block.
Oh, 1 times per week, okay.
Yep.
And you're confident that they'll change that if,
I have an email supporting that,
okay,
because I did ask the question.
all right.
And if you notice, there's also a $105 initial delivery charge that's stated on that contract. You can X that out and initial it. I've had that waived.
All right. Jason, I suggest you only get it done once every other week, but,
That's what we're gonna take a look at, if it comes to that case, and Bob and I work it out. Using this.
It won't take long to figure that out.
okay, all those in favor of the motion say aye. Aye.
Aye.
Those opposed?
Thank you.
Thank you.
Okay. Thank you for coming and bringing it to our attention. And Bob, thank you for your negotiation. I don't know which one of you is the best negotiator, but it's getting really close.
Bob is, but he owes me a cup of coffee.
Yeah. Commissioner Babson beat me last week.
Thank you.
Thank you.
I'll make sure that you guys get a copy.
Please.
Downstairs, in the book.
Amy, yeah.
Okay, well, you're here, you want to do the update?
Seaman, sure. The boilers have been fired up at the jail. They came online last week. And the boilers in this building should be online by the end of this week.
Okay. You're not leaving?
No,
Oh, okay. I'm sorry.
Boilers at the jail were put online last week.
Yeah.
And the boilers here in this building should be online by the end of this week. I
So
don't
we're
promise.
pretty much wrapping up.
We're getting near the end.
There's still a bunch of control work to do.
Yeah, there's control work to do. They're actively working on the humidifier in the vault down the hall. Bring that online, and when they're done with that, they're going to move over to the nursing home and work on those humidifiers and that control system.
They're estimating by the end of October they'll be gone.
updates. Are you part of the paving and flooring RFPs?
That's Jason primarily.
We're gonna wait till the end to do that.
Well, he's here, I didn't want to make him come all the way back if he wasn't.
He wasn't gonna come back. I mean, it's only an RFP. If you want him to stay, we'll do him. It's up to the board.
Did you write them or did Jason?
We wrote them together. This is Jason's project. I don't have my fingers into this one too much, but I'd like to be aware of what's going on.
Okay, so if we could do that now, please. You have any objection to that, David? Terry? No.
Save off some time.
Yes.
Thank you.
Which one do I go first?
It says on here paving.
The first one, an RFP for paving, the end of the driveway. We had the DPW do dirt work for us last year to extend the driveway out. It's always been too small over there for what we have for staffing. It has a bump out at the end that is, don't know why they just didn't finish it or didn't make the plans they called for. Last year we were gonna do it, but the county was gonna do the back parking lot, decided not to. So this year, we're bringing forward RFP to be able to finish extending that parking lot, and I had Bob work with me on it to make sure that we hit all the highlights we need to.
Did we put out an RFP for the back parking lot this year?
No, I just presented a rough draft for your reading pleasure.
We have to have money in the budget to do it.
I knew there was something, I
Yeah.
just didn't remember. Okay. So this is just, David, question?
Yeah, we're talking about just the area before you dump over the bank and out there at the end of the
Correct.
parking lot, right?
Yes.
But they have to hitch it onto the existing pavement.
Yeah, they'll cut, well, most likely they'll cut that, everybody I've talked to said they'll cut the section out that's a bump out, cut it straight, and then from there they'll do it from the end of the driveway and they'll attach it, basically.
Is that gonna need some sort of bumper structure at the end too?
No, we don't bumper structure down because that's where the DPW, they just plow, it goes straight out and off the edge. It actually will help with the plowing purposes.
Any comments? Comments, Dave?
No.
So you just want an okay for this today, is that it?
Yes.
David?
Yeah, again, it bugged me. Why do we need 5 copies? You need a copy, you need a copy.
One for each of you? I mean, you don't have to. We can have them just send one copy if that's all you want.
We get the copy, we get to see it when it comes in
Yeah.
in the morning. It's
Just, I'd rather use their paper than our paper.
Like, because remember, we pay for every copy that we make.
I understand that, but we don't make, I'm pretty sure that the 3 of us don't look at each copy of a proposal, and it just seems to me if I were running a business and I had to make 5 copies, it would be a burr on my saddle, I'll tell you.
Just.
That's standard procedure, isn't it? Isn't that part of our bid policy?
No.
No, but I believe I was in the room last year before when there was a vote by the commissioners to have that. He wanted 5 copies. It was in here at some point, it was discussed.
Not me.
You
Maybe
said
that
no.
was another 2-to-1 vote, I don't know.
Probably.
I only put that in there to make sure that everybody that needs to see it for this discussion has a copy, and I'd rather burn there, let them pay for the copies than us. If you want to change it, just tell me what you want me to put in there.
I think 3 copies would be plenty. If I want to look at a copy, I know where to go. I can go to you, and I can go to you and get a copy of it. Well, I can. We need one for the office for records, that's for sure.
I believe that when the proposals come in and we open them up, and then we look at them and we read the different amounts, Bob takes a copy and he goes and looks at it of the low bid. And I know I review them before he comes back next week to make sure that they seem comparable. Now, I don't know if Terry and David do that or not, so I would appreciate a copy. I think Terry does too. So David, if you don't want a copy, then we'll just go back to 4.
That's fine with me. I know where I can go to get the copy. I can get a copy from you, I can get a copy from Terry, or I can get a copy from these two. Oh, I don't need one.
Well, we moved the office, so now we're back to 5.
Okay. I think 5 is probably a sensible approach. I think what they would like, David, is for you to make a motion to accept this RFP, to have it put out. Now, I would ask that you put this on our website as well as where the other, and you're gonna do some direct soliciting also?
Yes.
And on our website, because people are complaining that they can't find stuff on our website.
I'll make sure it gets on there.
You want to make that motion, David?
No.
Okay. Whatever. I'll make a motion to accept the RFP for the paving of the back parking lot at the jail.
Do I have a second?
No.
I'll second that. All those in favor say aye.
Aye.
Aye. Those opposed? Okay. So I guess your RFP is good. And
We have one more.
You have one more.
we have a second one here. Was this money held over from last year?
So this money is the part of the flooring project. It was in.
No, this, the parking
No.
lot.
Nope, was not held over, so it's in this year's maintenance budget.
So this is also in the maintenance, okay.
Correct.
And the other one, the flooring is in the
The
maintenance?
flooring was encumbered.
Encumbered.
Oh,
Um,
okay.
So the flooring project is the administration area hallway, briefing room towards the bathroom, and the small kitchenette area back there. We already own the tiles. We have enough for all that. Basically, what we're needing to do is labor and maybe some glue. And then again, the money was encumbered for this project.
Okay. I guess, would you like to make a motion on this RFP? David?
I'm just quickly reading it.
Madam Chairman? Why was the money encumbered last year?
Just so we didn't get to that
Oh, we
from the
didn't get
building.
that point, okay.
We got to the inside hallway, got the interior part of the building, but then we ran out of time by the end of the year because the flooring people didn't get a chance to do that until towards the end of the year. So, and we didn't bid that portion out.
Yes.
Is that like the 17,000 that was left? Is that how much is,
No.
no?
We had like 5,000, a little
Yeah.
5,000 for this.
I don't know if you think about the wall project.
Well, it's been encumbered twice, 2 years in a row, right?
I think so.
And I think the first year might have been.
No, the first year that was encumbered, that was towards the matrix and camera system. That was part of that encumbrance. Okay, yep. So you did see that.
I'll make a motion that we accept the bid for,
RFP.
okay, why don't you make the motion?
It's just that you can't accept the bid, dear, because there isn't one.
To me, this is a bid, so you go ahead and make the motion.
Okay, I'll go ahead and make the motion that we accept the RFP for the flooring in the what part of the area is it?
Jail administrative area.
Jail administrative area.
Oh, second for discussion.
Okay. Discussion.
I- We don't have anyone that can pull the carpet up ourselves? I mean, I just,
It's not, it's also glued down, it's also
oh, it's
pulling it up,
glued down.
sanding it, getting it ready for the flooring, as we found with the other carpets, so it's,
It's fine, I just wanted to clarify that, because I thought that would be an easy.
Not like the carpet in your living room.
Yeah, I know, I pulled that up, that wasn't easy either,
no tech.
but it
it's all
wasn't glued.
Can we put it in our new dumpster over there?
That was part of the RFP, they got taken.
They would take it, yeah.
Yep, take it themselves.
Okay. Well, no, I was just thinking if we, because they'll charge for that, won't they?
Well, maybe.
We'll find out.
I'll let them have the burden.
Any more discussion, David? Discussion? Discussion. Okay. Motion's been made and seconded to approve the RFP to remove the carpet, dispose of the material, and install the new county-provided tile in the administration area of the Carroll County Department of Corrections. All those in favor say aye.
Aye.
Those opposed? Okay.
Thank you.
Thank you.
And,
All set?
I think that's all, Bob.
Thank you.
And Jason, you're coming back at 9:30.
No, we were gonna have stuff to talk about.
Howie, it looks like you're up next.
Good morning, Commissioners.
Good morning.
Now,
And Ken Melissa and Joe.
You want to explain your RFP?
The RFP is a request for proposal to purchase nursing home staff scheduling software. Has been budgeted, planned for this year, but you might remember that it first came before the board actually last November, but it wasn't ready for prime time at that point, because we hadn't actually gone out for an RFP. Since that time, and since it got included in this year's budget, we've actually had a core group of 5 of us, plus, and that being Director of Nursing, Assistant Director of Nursing, Scheduler, and our new clinical coordinator, also involving on the side Lisa Herder and Jessica Landry, because there are implications to HR and to payroll as part of this. So we really had 7 people actively looking, interviewing, meeting with different providers to get a sense of what it is that we really need. And we now feel confident and comfortable in being able to put together an RFP to find out exactly who can provide what we need. As you can imagine, scheduling 7 days, 24 hours a day is close to a nightmare for Candace. Right now, we are doing it with an Excel spreadsheet. It's a traditional way, but it has long since been deemed an archaic way. What we're looking for, we have to imagine, if you will, the new workforce. And what will you always find in their hands? A telephone, when they're not working. This would allow us to be able to reach out to staff with text messages and email messages, but primarily text messages to say that we have an opening on the second shift, 3 to 11. Not posting it as we do now in the break room, hoping that somebody sees it. It would allow them to be able to see their schedule at all times. It would automate a lot of things. It would allow that staff member who's sitting on the beach to get this notice, that there's a shift availability on Saturday, to say yes and accept it and be put on the schedule. So it'll as many of you know, the days of people calling you back on telephone are almost gone. You can leave messages and you can't even be sure they're going to listen to their messages for a day or two. So all the systems we looked at will do that, some will do different things. And I've tried to outline exactly what we as a committee have found to be an essential part in determining the requirements. I also have an answer for you for, the concern, because I think even I included, excuse me, Commissioner Babson, 6 copies. Do you know why the reason for the copies harks back to an early era? Imagine if there weren't just 3 of you, but you were dealing with city council with 15 members, and you had a $13 million construction contract. You would have a ceremonial opening of the bids. Nobody would touch those packets until it was announced, to be sure that there was integrity to the whole system, that nobody had worked a deal with a particular provider, that there were no kickbacks or advanced knowledge of what the other bidder was bidding in order for them to be $1 lower, or $1 lower or a week faster. So there's a certain tradition. None of that tradition obligates you to do. You can have as few or as many. But that's the reason that traditionally we do that. But glad for that number to be any number that you choose.
All right, any questions about Howie's RFP?
Yep.
Yes, David.
When the motion's made, I think it's a good idea. In fact, I thought that it had already been done. I thought we purchased it. Last time I saw Candace, he was still working with an Excel spreadsheet.
She still
But
is.
that was in January, I think. I thought we'd already purchased it. I will, when the motion's made, correct it to 3 copies. But other than that, I think you ought to have one, and I think the director of nursing ought to have one, and the scheduler ought to have one, but I can't see.
And the office has to have one.
Well, if we get one up in the office.
That's 4.
Typically what will happen, it's good for, it protects all parties, including myself, from any suspicion. It's best that, and you'll see that the copies aren't delivered to me, they're delivered to Ken. So that I don't know what they're gonna send back. And then typically, and the board does this very well, you'll see the different proposals, and there'll be a mix mash of things. Because the low bid doesn't mean it's the best bid. Then you would refer back to the committee for review these bids and come back with a recommendation. And that's the time that we should see it, is after you've seen it first, so that it doesn't look that we're in any collusion with any of these vendors or this, so that it's the integrity of the system is protected.
Well, frankly, Howie, I think we've done a pretty good job over the last 3 to 4 years of opening bids.
An excellent job.
I don't think anybody thinks that we're colluding with anybody. And I'm proud of the job we've done, because it is fair and equitable, and it seems to be working.
It certainly is.
Ken?
Howie, like how you have references,
Correct.
that would be good to call in some references, find out how it's working, and not just go with, someone's
pitch.
Yeah.
And that's important, because we have one of the vendors who we like the best. We've tried to do some preliminary checking with references, just to try to get a sense of questions they ask. And some references have come tough from some, so, if they can't or refuse to give us 3 references with contact information, we don't want to buy a pig in a poke. I think this will force them to do what they should be offering to do anyways.
And I think it'd be good, because then Candace can talk to the references and understand and talk the same language.
Exactly.
So I think that was a very good idea. Okay. Any other comments or questions? Okay. No. So, somebody want to make the motion for the RFP?
I will. I'll make the motion to accept the RFP for the nursing home staff scheduling software as written.
You want to second that, David?
No,
I'll second that. Is there any more discussion?
I'd like to see it changed to 4 copies. I don't think we need 6. I think that's overkill, costly to the person bidding it, and that's gonna reflect in the cost we get from them, small as it might be.
I have no objections, do you? If Howard needs 6 copies, he can make 2 more copies.
Oh, as long as there's 3 for one of each of you, that's the critical part. That's the critical number is 3.
I don't need one, Howie. I know where the copies are. If I wanna read it, I can go read it.
Oh,
So you said 4, David?
Yes. And if it's at 4, I will second it.
You want to amend your motion to include 4 copies?
Not really. I think when we open, it's open for discussion, then when we open them, we should all have one sitting here looking at them. Now, if we have to make the copies ourselves, then they have to be opened ahead of time.
Okay, so we sit here, excuse me,
Yes, David,
and respond to Commissioner McCarthy.
certainly.
When we sit here and we open them, Terry, there's the box with 6, 7, whoever knows how many. We can each have one and look at it while they're, while we're opening them, and then we turn them over to Howie and his crew, so I don't think that, I don't know, you can go ahead and do what you want. I can tell you it's a cost to the people bidding or answering, and it's reflected somewhere.
Okay, was that a motion to make an amendment?
Yeah, well, yes.
Okay. Is there a second to David's motion to make an amendment? If there's no second, the motion fails due to no second. Melissa, would you read the original motion, please?
To accept the RFP for nursing home staff scheduling software as written.
All those in favor say aye.
Aye.
Aye. Those opposed?
thank you, Commissioners.
All right.
Madam Chair, if I might?
Yes.
I just want to point to the emails that I sent you with the good news part, because sometimes you're only receiving the concerns of the complaints. But I'm not sure if that made it to your packet or not.
It did. It's in the packet. The lovely letter that was written is in here also.
And if you do get a chance to go on Facebook, to look at that posting, it's amazing to me that there are 5,500 people that have viewed our little posting, but what's really telling are the comments. There are 40 comments, and some of them are just heartwarming to read.
And that's the Mountain View Community Facebook page,
Right.
correct? I think it was nice that you created that, because that gives the friends and family members a place to go.
It has surprised me by how many people look at it, but when I see something, and the posting was about an activity that we did for residents that Susan and her staff coordinated along with our therapy department. Now, I know this is going to sound very strange, you all remember the slip and slides from the old days? Well, that's what we did with residents. And to see the residents get into this inflatable duck and go down this wetted down tarp to slide around, they had a great time. They had a great, it was wonderful to watch. And obviously, people kept going back and back to see the slides of it.
I would have liked to have participated.
Well, there were also Namia residents with squirt guns squirting everybody that was going down the thing. So anybody that was riding the duck was also a target. So
Oh, it sounds like a good time was had by all.
it was.
All right. And that, I think, is everything from you today?
Oh, except for, I think, the transfer and the new hire.
You have a transfer?
Yeah, and Paula sent it over to you this morning. $2,000 for Bob from payroll to overtime.
At the 8:20. I could run downstairs and get it.
I have a copy here.
Oh, you do? Okay.
Which brings us, Howie, I would like, from now on, if we could, to get the things to the office so we could have an agenda on Friday morning or Friday afternoon.
That, in fact, I'll talk to Paula about that, maybe just to end first.
I have it here, so you can just read it to them.
The
I have it in my
request,
email.
the request is for $2,000. Bob has had some unfilled positions, so this isn't going over in budget, but when he has unfilled positions, it requires some incidental overtime, especially during the summer when there are vacations. So we're still running under in payroll, but the regular payroll has been down, but it also meant overtime has been up by
I did it.
a relatively modest amount.
Okay, so you want to transfer it from your salary line to your overtime line
Correct. All within the,
in maintenance? Bob knows about this? You didn't see it?
he met or discussed it with Paula. The number was his.
I'm sending it down to David.
We haven't done this already?
Paula says no.
Okay.
But Bob hasn't signed it.
Is there a place for Bob to sign? I know that
Yeah, it's, yeah, you know how you have to sign them?
no, I signed it.
Oh,
But
So it doesn't have to be done today.
yeah, delegation meet Monday, so that would be a good time to get it done.
But I thought we agreed that we wanted the department heads to sign these. Bob's the department head of maintenance, right?
the department head gets used interchangeably within the county to mean either Jason and me as department heads, or as, well, in Bob's in kind of a unique position with facilities, because he's beyond just Mountain View, and so I don't have a clear answer for that. This particular part comes under Mountain View's budget, so I signed it as the department head, looking at Bob as being a supervisor in that capacity, but we've never had director of nursing and others do it separately before.
Comments? You have a comment, David?
Only that I think the discussion about department head signing it is a waste of everybody's time. If Howie looks at it or Bob Murray looks at it, that's fine with me.
Yeah, I would accept recycling it because you're
Yeah,
administrator of the
Building.
Met with
Building.
Paula, and Paula met with Bob,
Okay.
and it really does come under the category of routine and anticipated at this time of year when there are unfilled positions. That position, we're optimistic that we can have it filled as early as next week, so it's been unfilled now for a couple of months, but.
Anybody want to make a motion on that transfer?
We'll make a motion that we approve transfer number blank. Moving $2,000 from, where's the account number? 5150:09 to overtime 5150:05, and it's $2,000.
I'll second.
We ought to put a transfer number on there.
Do you know what? Oh, he's gone. I don't remember what the last transfer number was. Do you, David?
No?
I don't have last. We can,
Here comes
many transfers last week, so I can't tell you.
Yeah. Ken, do you know what transfer
Here's
number?
Bob, if you need Bob information.
Bob, there, Howie's asked for $2,000 transfer from your maintenance department salary
Yes.
to your maintenance department overtime.
Yes, I've been down a second shift staff member for a couple of months now. We just filled the position, but I've asked my other staff to cover those overtime shifts.
So you have hired a new one?
I have hired a new one, and he's supposed to start Monday.
Nice.
Yep. But we've had to use some overtime to cover hours.
Do you know what number this one would be?
It'll be 14.
14.
Madam Chairman, can I see the transfer? I'll change my motion. I'll change my motion to accept transfer number 14. Make it simple.
Oh, I seconded it.
Okay. All those in favor say aye.
Aye.
Aye. Those opposed?
And
Yes.
just a point of information that you had Howie sign the LNA transfers, so. In the past.
What do we got so it's working so well here? The air conditioner?
Yep. It isn't being reheated because the boiler's not on yet. So aren't you glad you wore your winter
Yeah.
sweater?
Feels good.
I'm fine today.
Madam Chair, I have one other point of information, if I could
Yes.
briefly. And that's a couple of questions that come to me, and maybe it's come to you as well. Just want to reaffirm and assert that with regards to admissions to Mountain View community, we always give priority to Carroll County or Carroll County connected residents at all times. You know, it's very important. We have, you know, and within that that being the first cut, the next consideration is urgency and need. Not necessarily length of time on the wait list, but the urgency and need. There's somebody who's in a critical situation is going to come before somebody who's safe and stable, even though desirable and needing. And that process, and that's one that we worked with the commissioners on developing that policy some 5 years ago, and it served us very well.
Howie, I have a question about hiring people. When a person's been hired, it's on condition of a background check, correct?
Before they're hired, there's a job offer made that's a conditional job offer. So they're not really hired until they meet those other requirements. Typically, health review is needed, and definitely the criminal background check. For our nursing staff, there's something that's called a BEAS check as well. So yes, we hire them, but we have to have confirmation.
Is a drug test one of those health requirements?
Is not.
Have you thought about that?
We have, the county has we do have a drug policy that
I realize
allows
that,
us to test.
But prior to actually hiring, I've noticed that many of the companies in the county now are doing it.
We have no routine testing.
No, prior to hire.
We have no
It would be
routine.
like the background check and whatever, they would have
Correct.
to have a drug test, pass a drug test.
The challenge and the reason it hasn't been put forth is you would have to decide as commissioners exactly what drugs you'd be testing for. Would you be testing for all illegal substances? What would you be testing for in that?
Well, I think they have standardized testing. Like White Horse has standardized testing that they do on the people that are on probation and things of that nature. Yes, David?
Madam Chairman, can you name a few of the many companies that are now drug testing before they're hired in Carroll County?
The one over in Wolfboro up on 109A. I don't know the name of that company right off the top of my head.
Well, you said
Ossipee
that-
Aggregate does.
But don't they have to do that because they're driving vehicles that could crash on the road? if
I
they're on the
don't
influence.
believe the manufacturing company over in Wolfboro has people on the road. It's just I believe, when I was speaking with the man at the post office, it's a federal thing now, that federal employees have to pass a drug test before their hires
So
confirmed.
where's the federal company on 109A?
No, it's not a federal company, it's a manufacturing company. It's out by the SAU office. And I'm desperately trying to think of the name of it. It's where they used to make the long underwear, and they don't now, they make something else. Ken, you had a comment?
Yes, when Javi and I were looking at this several years ago, and we were talking to Primex and also to our outside counsel, and there's some things we need to consider before we move forward, and that is, what if they live in Maine and marijuana is okay, over there, but it's not like okay over here.
Or Massachusetts?
Yeah, or even Vermont. I mean,
When
this
you
is-
have a drug test, if it tests positive for anything, it tells you what it tests positive for, because some people are on a prescription Adderall, which
Yeah.
would show up as meth. So things of that
Some are on
nature.
OxyContin, some are on all kinds of stuff.
So those things would show up.
What I'm saying
But I
is,
think it would protect us, that's what I'm thinking, because it would just be, I would think, another layer of protection. Yes,
Being practical, I agree, if we could exclude cannabis from the list, that's part of the test, but as long as that wouldn't be a disqualifying condition.
well, I think the disqualifying conditions would be up to us to decide what they would be.
Exactly.
You know, the tests are standardized, I believe.
Well, you can get multi-panel tests in all kinds of configurations, so that you can get 5-panel, 6-panel, you can get the testing customized. The real question, traditionally, it was the test for all illegal substances. Cannabis, marijuana
Right.
is technically, I think, illegal. I'm not sure, I think it's been reduced to misdemeanor, but you as a commission would have to decide whether the presence in any amount, we're not talking about impairment, but whether the presence would be a disqualifying event. If it were, it could severely, significantly affect our ability to attract new staff.
that's why I think Home Depot's not doing it anymore, I think, because they lost their pool of applicants. I don't know, it's a thought, I mean, something we had looked at prior.
Terry?
Yeah, but it might limit the pool, but do we actually want someone that's on drugs, working in a nursing home, dealing with people that, are incapacitated, or, I don't know, I think that's a tough question.
It is, and it really, there are two schools of thought, that
Yeah.
marijuana is more akin to beer than it is to hard drugs. Now, whether that's true or you agree or not, that's a different matter. But testing for cannabis would significantly impact our ability to attract staff.
And the same token, would you want someone in there that's had 3 or 4 beers to go on duty?
Oh, we have a definite, I mean,
So there's,
no question about that.
That's
We-
different though, I mean, I think we're talking about two different things.
right,
If somebody's
We are,
working,
we are.
impairment by any drug, prescription, non-prescription, or recreational, is reason, justification for testing, and if found conclusively, for termination, nobody can work impaired. The significant problem with cannabis is, as I understand it, is the tail for the testing purposes. You smoke something on Saturday and you come to work on Wednesday and get drug tested on Wednesday, it could show that you had the presence of something, not that you're impaired,
right.
the THC, but that you had something, and that could be a problem.
Well, I think you're deflecting the question that I asked. My question was about, drug testing for all drugs, all illegal substances. To focus on pot, I'm not sure that that's really necessary because that's so close to a borderline now, but
See, if you excluded that, I would have no problem.
what I was talking about, is the opiates and illegal type street drugs, but just a point of interest, I really think that, I'm surprised that Primex wasn't in favor of it, because I would think it would be another layer of protection.
But you also open yourself up to lawsuits too, so. There's a fine line. That's why you gotta get it right, you gotta get the policy correct and
And what's the
and
cost?
fine-tuned.
What
It's
is the actual?
$100 a test.
Well, all depends. I mean, we have the testing and how many panels you do. I mean, if you're doing 15 panels, more than $100, you pay that.
I don't believe so, you can check, White Horse does it, they do a regular standard one. They do it for the jail, I believe, when they do
No, they don't.
probations. The probation people don't do it?
We do it ourselves, right. And then if it comes back positive, then we send it down to Stratford for the higher analysis. Because they've got the machine down there that actually tests everything. We just have the cups that you turn them over and,
Right,
So
no,
the
that's,
panel.
yeah. But David, I will get a list of the companies, names of the company, as well as that name over there of that particular one.
Okay, thank you.
Do a little more background as to, I'm pretty sure that was a 15-panel test for $100, but I will check on the cost.
it costs us about $2 to do it.
A 15-panel test?
All it is just a cup, and you just flip it over. But if it comes back positive, you need to send it out, because there's so many false positives.
Right, okay. Anything else for us, Howard?
That's all I have,
Okay.
until it's non-public in time for a new hire.
Okay.
Thank you, Howard.
Thank you, Commissioner.
Would you tell Jason to come in?
I will do
It's
that.
9:32.
Joe left.
Yes, he said that he did leave. He said all the checks are signed, except there was no check attached to this top invoice.
Okay.
Can I see the time?
Budget discussions? Yes. Yes, David.
Is treasurer leaving?
I believe he's left, yes. Jason, you have a 9:30 appointment with us?
You?
I wish I was a wig salesman.
Good morning again.
Good morning.
So here this morning to talk about MAT. I have a policy for you guys to take a look at. I have Chris Raga here as our doctor to talk about MAT a little bit, and these guys helped put together the policy. I have Superintendent Keith Gray here today from Belknap County, who has the same doctors that we do, who just had their board approve the MAT policy, medicated assisted treatment, since I'm just using the short term of it. And I brought our legal backup on it, but to start with, I was going to bring our doctor up here to talk about where we're at and what we're looking at for medicated assisted treatment, if that's okay with you.
Yes, but I'll repeat to you what I said to Howie. I would like you, when you want to be on our agenda, that you get it into Ken on Friday, so that we have a chance to peruse, so that we can get the agenda ahead of time. We didn't have a copy of your proposal, we didn't get that
You
until
did.
just now.
You did, because that didn't come in till, finishing it till late, so you wouldn't have had that Friday either. So that I just,
So things of that nature, if we could get them ahead of time so that we can study them and look at
yeah,
them.
that just got wrapped up because the doctors had to add a couple extra things to it, so that's why just be able to get it done. So Chris and Keith, if you want to join me up here, so this is Chris Schwager. part of our doctors from over the jail, and this is Superintendent Keith Gray.
Morning, Commissioners. Good morning. Madam Chairman,
Yes, David?
could I ask Chris a question?
Yes.
Chris, when you first were hired here, way back, I can remember, how many counties are you working with now? Is it 3 or 4 or 5?
As of yesterday, we actually just picked up Merrimack County, so we're providing services in 5 county jails: Carroll County, Belknap County, Hillsborough County, Stratford County, and now Merrimack County.
So you get a real overview of the problem.
Yeah, I mean, we see it from here in Carroll County, where there's very minimal resources in the community, to the other extreme, where in Hillsborough and Stratford County, they have an abundance of resources.
Thank you.
It might be helpful just to give I've been doing primary care medicine, family practice for 25 years. I work at Dartmouth, I still work at Dartmouth. I've been doing correctional or jail medicine for approximately 12 years. I'm on the lines, I see patients every day, and this is a major problem that pretty much interacts with a majority of patients, whether they're in a private setting or in a jail setting. Unfortunately, I'm sure everybody in this room knows that this is literally an epidemic, and New Hampshire is considered to be the epicenter of this problem. Unfortunately, it has some pretty negative social stigma associated with it, and there's a lot of misinformation. But for us, from a medical standpoint, it comes down to a simple thing, in that we're obligated to provide the same level of care that's available in the community to treat a medical problem. So just like if a diabetic who's out in the community, homeless, not taking the medication, when they haven't been taking it for 2 years, when they come into the jail and they want to initiate therapy, I'm obligated to provide them with that medical therapy. And medically assisted therapy, it falls under the same genre. I mean, it is the standard of treatment in the community, unfortunately.
And I brought forward, I know you haven't had a chance to review it, for next week, is the Medicaid-assisted treatment policy that the docs here are trying to standardize as best as possible. Belknap County, Keith Gray just got his passed by his board a week or so ago.
Last week.
The Medicaid-assisted treatment policy. It starts with, if they're on it, they continue with it, and if they need it, they could be induction. It's very specific, though. You have to have counseling, which Jim's daughters here can talk about that. You have to have counseling, lab tests. There's all kinds of criteria for it to be on Medicaid-assisted treatment. It's not just if you want it, you get it. You have to go through a lot of different things, including education and assessments, to be able to even go on Medicaid-assisted treatment.
I'll add that the patients are monitored for exposure to other drugs, and even being in jail, unfortunately, there's potential for drug exposure, so they get urine drug screened randomly, and if there's things that are not supposed to be there, that is addressed. Typically by either discontinuing therapy or maybe giving one more chance with some counseling and increased supportive psychotherapy. So how this essentially, there's a couple of different options when patients come in. There's essentially 3 different standards of care for patients who have opiate use disorder. One is methadone. That's not something that can be used in a correctional setting. You have to be licensed by the federal government in a freestanding clinic. So those patients who come in and they're on methadone, what we end up having to do is we transport them to a methadone clinic to maintain their methadone therapy.
Where's the closest clinic to here?
Stratford. Dover.
Dover has a meth clinic.
Yeah. Concord has one as well. I'm not sure how.
I think Franklin.
Yeah, Stratford's the closest for us.
So those patients are just maintained on their therapy. There's no benefit to switching them over to any other type of therapy, even if it's easier for us. Vivitrol is an injectable medication that can be given once a month. There really is no strong data to support that it gives long-lasting abstinence. Most patients don't, they might engage in therapy while they're in corrections, but most patients, once they're on the community, they tend not to maintain therapy because the Vivitrol doesn't block the opiate receptors very well. And so what that kind of leaves is Suboxone, which is a medication that's been in use for almost several decades at this point. And it's in combination with a medication that naloxone, which is a safety agent that theoretically, if patients have exposure to other drugs, it will potentially protect them a little bit and they won't overdose. What the medications do is it's pretty acceptable and widely known that patients who have opiate use disorder, their receptors on their brain, that's what stimulates the physical as well as the psychological addiction. So when somebody withdraws, they actually have they're pretty sick because there's a physical component. And so what the medications do is they sit on that opiate receptor to avoid that craving, and it allows them potentially to function as a normal person in society.
I was under the understanding that Suboxone was actually an opiate pain reliever, and the naloxone was lessened the euphoria of the opiate.
The naloxone's really more of a safety agent. Essentially the naloxone is Narcan. That's what we give patients to, if they've overdosed, to take the opiates off their opiate receptor sites if they're overdosing. So that's intended to act as a safety agent. That's really the only intention for that medication. And yes, Suboxone is an opiate. Methadone is an opiate.
Both addictive.
Yeah.
David, do you have a question?
Yeah, doctor, many people watch this video, and could you run us through the typical, somebody that comes in off the street is addicted to whatever. What do you do, measure it or believe what they're taking? I mean, how does this process work?
So somebody coming into, whether it's in the office or in a correctional facility, they come in desiring medical therapy. How we typically confirm that they are actually taking opiates would be to do a urine drug screen, and we would expect to see opiates in their system. That's the starting point to confirming that they're on opiates. You do a comprehensive history documenting their substance exposure, their treatments, what they've had for treatment in the past, if any, and then you present to them the options as far as treatment. Some patients don't do well with Suboxone. Some patients do much better with methadone. Methadone is a very regimented procedure. You have to go to the methadone clinic every single day to get your doses, and after a prolonged period of time, they might give you a week's supply if you've been a model patient for several years. The problem with methadone is it really has although for some patients it's good, it really has a negative social stigma. For the professional who, let's say, got addicted to opiates and they're in a methadone clinic, and if they have to travel, they're an engineer and they have to travel out of the state, that affects their ability to work. Suboxone is easier to manage for the patient because it's prescribed in the office. You can give a 30, once they're stable, you can give them a 30-day prescription, so it allows them to interact more normally in society. But it all comes down to the patient have to actively want to participate in medical treatment. There are certainly a significant amount of patients who, even given the opportunity on a silver platter, they will not participate. And those patients who, for you guys who come into a correctional setting, and this is something that we see regularly, they're here for 9 months, they're here for 12 months, they have not been getting any opiates to the best of our ability, and they go out into the street and then they resume their opiate use at previous dose that they were taking before they came into the jail, now their body is not used to that medication, and typically they die. It is definitely the correctional population is definitely a very, very, very high-risk group of patients. They're 10 times more likely to die from opiate use disorder than somebody out on the street just using it.
Where did you get that information from?
That is available in SAMHSA, which is the Substance Abuse Mental Health Services Administration, that data.
I didn't find it.
There's literally 500 pages of.
I have spent a
Did you,
week
did you, the
looking
national
through
practice?
this. No.
No, that's just the cover, this is the
You
whole.
would probably get better reference, it's called SAMHSA Tips 41, which goes through all the past history.
Oh, yeah.
Yeah.
Doctor, so at the end of the individual's stay here and they're now going out on the street, what have we accomplished?
So if the patient is elected to start and maintain therapy, they've been getting counseling, they've been, being seen regularly, working on the behavioral component. What ends up happening is that patient, before they walk out the door, they're handed off to a provider in the community. So we can't prescribe medication for a prolonged period of time when they walk out the door. We might give them 3 days of medication. They have to have an appointment with somebody to maintain their medication and transition their care to the provider in the community. But that is something that is actively done by will be done by our staff.
How many providers are there in Carroll County for Suboxone?
Not a lot. I mean, that is a major hurdle that you guys have in this area. North Conway has limited availability. I mean, there is nobody around here within 20 or 30 miles or so.
Jim Stoddard has some information on that.
In Carroll County
6, I believe.
that provides Suboxone?
Yes.
Is that pill form or the film form?
Typically, they do the film.
No, I mean, that is definitely a huge issue for up north. You go down to Hillsborough and there's probably 50 people in Dartmouth Hitchcock Clinic, Manchester alone, who potentially can prescribe. A lot of practitioners end up getting certified and trained to do it, but they never initiate that type of care because, again, some of the negative social stigma associated with it. And truthfully, these subset of patients, they're hard to manage. This has been
This is my concern. We have a person who comes into our facility. They're addicted to some opiates. They're not on any kind of a treatment program. And we say, okay, we're not going to give them to you. You're going to withdraw. You get sick, and they withdraw. We keep them here, abstinence, 6 months, whatever. We send them out in the community. Now, we have given them a tremendous amount of counseling and well-designed programs to help them stay abstinent once they leave here. That's one option. That's what we've been doing. How successful, I'm not 100% sure. We've been told it's been quite successful. The second one that we're now talking about is the same person comes in addicted to opiates and says, oh, I don't want to get sick. I don't want to go through withdrawal. I want medically assisted treatment. I want Suboxone. So we put them on the Suboxone. We still give them all the counseling, but they're still on Suboxone. They are not in any way opiate-free.
Correct.
They walk out the door, they are addicted to Suboxone. We give them a follow-up appointment. Somebody has to pay for that Suboxone when they're out in the community. First problem, not many places they can get the Suboxone. Secondly, there is a cost involved. Thirdly, it has a street value. Those are my objections to this. We take somebody that hasn't entered treatment, had no interest in treatment, we tell them they're gonna get sick, and suddenly they want not to get sick. I can understand that. But then we let them leave here addicted to a different substance, or they may have been addicted to Suboxone in the first place. Secondly, what if they come in and they're addicted to some methamphetamine, such as Adderall or something, that Suboxone apparently doesn't seem to have much of an effect
It
with?
has no effect whatsoever. There are no known treatments for methamphetamine.
And they say, we don't want to get sick, we want to go on Suboxone, we want to go on medically assisted treatment.
It's not even the same thing. That would not be an option for that patient. If they're a methamphetamine abuser or an alcohol abuser or a benzodiazepine user or marijuana exposure, they're not going to be treated with MAT because they do not have an opiate use disorder. So methamphetamine, the likelihood of dying is much, much, much less for somebody actively abusing methamphetamine. It happens, but not to anywhere near the degree of opiate or unfortunately alcohol. They kind of fall in the same place.
How are you going to know when the person comes in here whether they are in fact a meth addict and not an opiate addict?
Again, they're going to get a urine drug screen, and if they're positive for methamphetamine and they're negative for Suboxone, we're not going to treat them for an opiate use disorder. The reality is, unfortunately, in the street venue, drug addicts are becoming increasingly aware about the potency. Everybody thinks opiates heroin. I mean, there's very minimal heroin in New Hampshire. Almost all the deaths are associated with fentanyl, or carbofentanyl is now the new player, which is even more potent than fentanyl. So drug addicts are not necessarily stupid. They know they're having exposure, and they're actually now taking methamphetamine in conjunction with opiates to potentially limit their potential likelihood of having a respiratory or death. When most patients come in, they have multiple things in their urine. I mean, they'll have opiates and benzodiazepines
And they know they're coming to jail. And if they know they're coming to jail and they have opiates in their system, they're going to have Suboxone. Even though they're a meth addict, they will use some opiates before they get here for their urine test.
Right, but there has to be a long history of potential. So the patient coming into the jail, and they've now been through the jail 5 times the last 2 years, and every single time they screen positive for opiates, that patient clearly has a chronic problem. Yes, codependence with another drug is incredibly common, but it doesn't carry the same mortality or morbidity rate associated with opiate use disorder.
I know, but you're still going to give them the same option for MAT.
If the patient has a diagnosis of opiate use disorder in the moderate to severe range, then yes, if they desire, they would be eligible. Some patients may have no desire and they just want to detox, from their street opiate use, and our legal system has made it very clear that federally in multiple cases that what we do to manage patients' detox, which is give them Imodiums for their diarrhea and other medications, is cruel and unusual punishment. That's what they have defined. We are not.
Which court decision was that defined?
There's a case.
I haven't found any except the one in Maine. and
There's
that
another
was
one in
different.
Massachusetts, there's another one in Vermont.
That is what Jason had referred it, but I was unable to find either of that. So if you
I'm
could
sure
give me those, I would appreciate it.
Jason can provide those.
So my objection is still the same. You get a person in here, might be their first time here,
Mhm,
and they come in and they test positive for opiates.
mhm.
We then put them on Suboxone.
Not necessarily. I mean, there has to be really so the patient has a positive urine tox screen for opiates. I mean, if they just had exposure to very minimal amounts of opiates, it's really not a medical problem. You're not going to treat that patient.
How do you know that?
It's like any other medical problem. When a patient comes in, you get an adequate history, and you look at their, you look at their physical body. I mean, most patients who've been abusing opiates, they really do appear generally unhealthy. I mean, if they have track marks all up and down their arms, and they're chronic opiate users. The other major thing that we're kind of missing is that it's generally accepted in medical practice that there is a biochemical defect in patients who have drug use disorder, whether it's alcohol, whether it's marijuana, or whether it's opiates. They do not secrete some of the normal neurotransmitters that you and I secrete. And yes, you can put that patient into a program and provide them with all the emotional support and counseling, and in a confined environment, yes, they do very well, but you're still not addressing the other half of the equation, which is the biochemical part of the disease process. And that is becoming, that's what's driving medically assisted therapy. You go back 5 or 7 years ago, and patients were initiated on Suboxone, the general thought was you treat them for 1 or 2 years, you get them stable, you get them participating in work and doing all the things and being a good person, then you can go and stop it. But the problem is that there's been multiple data points that support that you can be sober for 4 years, 5 years, 6 years, 10 years. You have a very, very high risk of reoccurrence of going back to that drug. And unfortunately, that drug carries with it a high mortality or morbidity rate. And it doesn't have any boundaries anymore.
I would like to see those results, those studies that have been done, because I'm not finding them anywhere.
I mean, that is generally, if you look in the medical literature, those things are readily available. But all of us in this room can go round and round and round about what our personal opinions and the science and everything, but for us on the front lines, it comes down to a simple fact. In the community, this is considered medical care that is standard in the community, and by not providing it, just like if, again, they were hypertensive, and I said, all right, now I don't want to give you your lisinopril for your hypertension, I'm going to get sued. Or, yeah, I know you're a drug addict and you have been treating your diabetes for 2 years, and now you're in jail and now it's convenient for you. I have to treat that. If I don't treat that, I'm not following medical standards in the community, and I'm going to lose my license.
But you're not addicting them to another substance.
Unfortunately, that decision has been made way above you or I or anybody in this room. The experts have stated that this is the way to treat this problem. And again, do I personally necessarily agree?
It's part of our responsibility, the health of the people that are incarcerated here.
I understand that.
Okay, so I take this very, very seriously, because I have seen what happens, because I taught high school to kids that for one reason or another get involved in the drug culture, and what happens to them and their families. And I want to be very certain, if we're doing this to somebody incarcerated in Carroll County, under my supervision, so to speak, that I am 100% convinced it's the only and the best solution. Now, I have seen people come out of Carroll County that are practicing just abstinence.
Mm-hmm.
And they were not good when they went in.
That's
And
part of
this
the
has
policy.
been part of their saving.
So if part of that policy, they can still do abstinence. That's something that's in there if they choose to do that. And these are people that wish to continue with this type of treatment. Again, as we've seen, many people with abstinence, and Jim Starr can tell me, Jim, how many have died in the past few years in this area?
Last year was 16.
That were incarcerated here and went out.
No, 16 in Carroll County. I'm not sure how many were
We've
incarcerated.
had a handful incarcerated that have gone out and died.
But we
I-
did have, I will speak to that in the fact that we did have, 2 years ago, several people that were released from the facility to go out to treatment. And 4 people in a month, okay? All 4 overdosed, 3 of them fatally.
And those are some people that
That
might,
wasn't in your statistics that you gave at that presentation.
That's because they weren't individuals from Carroll County. They were individuals that were located here that were released, so they went back to other counties.
so what we're saying with that is, there are some people that this would work for. Just like methadone is long-term, this might be long-term so you can function and be part of society and not die. I think what we're missing is, this whole thing was put together so to avoid cruel and unusual punishment, and also to really work with making sure people do not die. That's the bottom result of MAT.
I mean, there's nothing in medicine that's perfect for everybody. I mean, again, there are some patients who are just gonna say, look, I have no intention of participating in counseling. I have no intention of wanting to take any medication. I'm gonna maintain my sobriety by just praying to God and doing what I'm doing. And I don't want any medical treatment. There are definitely patients who wanna do that, but there are also patients who, you know, you're talking about patients who are abusing drugs and typically have severe symptoms and are non-functional in society, and the role of stabilizing their disease, and it's been documented that these patients who have their opiate addiction or their alcohol addiction treated, they're much less likely to come back into the jail. They're much more likely to be working in the community. That data is out there, and that,
Well, then that contradicts the fact that we're concerned about somebody that's on a Suboxone program showing up at our jail, and we need to continue that program. Or if they're on a methadone program and they show up in our jail, we need to continue it. I mean, if the studies that show that Suboxone and methadone keep them from coming back to jail,
why are we discontinuing it?
why are you now concerned about them showing up in jail on these programs?
This
You
has
can't
been,
have it both ways. They're
No.
either working or they're not working.
this is a concern that we've had for a very long period of time. My colleague and I have had this conversation 7 years ago. Eventually, we are going to get sued and get into a big problem because somebody's gonna come in, and because Suboxone or opiates are generally not allowed in the jail, and that's the superintendent's decision, we're gonna take a patient who's been on Suboxone for 3 years and stop it. And then what's gonna end up happening is that patient's gonna go out in the community, overdose, and then a smart lawyer is gonna pick that up, and everybody in this room is gonna get into big trouble.
Whether you
So
like
to
it or-
prevent it, we just let them get addicted. to
No,
Suboxone.
we're following, it's very simple. We're following the treatment guidelines that are already established in the community. If a patient is an active opiate user, they can go into Conway emergency room and initiate and get Suboxone therapy immediately in the ER. I mean, that is standard of care now. And then their care is arranged the next day in a clinic privately. But that's what happens now. Patients can go to multiple ERs in the state of New Hampshire. I'm an opiate addict. They do the same thing. They confirm they're opiate. They have opiates in the system, and they initiate therapy.
So
That
they,
is
can they
standard
also
care.
do that at Huggins?
I'm not sure if they do that at Huggins, but at multiple hospitals in the state, Elliott.
We only have
medical-
2 in Carroll County,
I'm
one's
not-
Conway and one is Huggins. But you said Conway definitely does, and I was curious as to whether Huggins does or not.
Yeah, I believe that both of the hospitals have stated that they're going to be implementing that program. I'm not sure if they have started it yet.
You said Conway has started it.
That is what I had been told, is that there are, if they are not doing it, they are getting prepped to do that.
Right.
And that was a matter of actually a bill that was passed at the state for,
I believe, for docs to be able to provide 3 days of Suboxone in the emergency rooms. So that was a statewide initiative.
Detox, right? It's part of a detox system.
No, as initiation of their medical therapy.
David, you had a question?
So, Doctor, where does the legal part come in? When they come into the jail and we stop it? Now that's, we've got the program on the outside that the regular society says, okay, they come into the jail, we stop it, and that's cruel and unusual punishment?
Clearly, in the last 2 to 3 years, has gotten a huge, it's on everybody's radar. And so we're talking about something that has not been on anybody's radar. You know, prior to 5 years ago, you talk about opiate use disorder, and you weren't talking about the judge's kid or the police officer or the superintendent's kid or the dentist. I mean, at this point, it's pretty open that this affects everybody in the community, and there has been heightened focus in the last couple of years, and that's what's driving it.
You asked about legal, so yes,
Where is the legal?
Smith versus Aroostook County, that was the first circuit court said that they're on it, you need to continue it, and that was done by the court. There are other ones that are around here. Here's where you're at. You have Belknap County, Stratford County, Hillsborough County, Merrimack County, Rockingham County, Cheshire County, Cowas County, Sullivan, all doing MAT. Okay. The state prison just started MAT. All because there's lawsuits that are around the area and to avoid lawsuits, quite frankly. I reached out to one of our attorneys who works with Primex, and they don't want to give an opinion right now because they're waiting for the lawsuit. Whichever one of us says we're not going to do it is going to be sued, and then Primex will have to cover us at court. Whether this county wants to be that one or not, that's why I bring an MAT policy forward. I worked with the doctors, I worked with fellow superintendents, and my opinion that we need to move forward as a county under MAT, and that's why the policy is there for it. You guys get to decide whether you're going to approve it or not, and then we go from there.
I mean, I have to follow the medical standards, and if I'm providing the acceptable level of care as patients should have this option, and, all right, so you guys make a decision, so you're not going to provide that level of service. Okay, you have a diagnosis of an opiate use disorder. I agree with that diagnosis. It's, unfortunately, it's above my pay grade, and I cannot, I'm handcuffed, and that's going to cause some conflict, ethically for us as well. I mean, how are we going to be able to, provide medical care when our medical care is supposed to mimic the community standards, but it's being restricted? I mean, that's a big conflict for us. And again, I'll point out, I'm conflicted about Suboxone. I mean, I have some of the same concerns. I mean, it's not been around for, 50 years or 40 years. I mean, theoretically, in 10 years, we could say, all right, this is maybe not the best decision. But unfortunately, it's reflective of the current treatment in the community. And if it's not maintained, just like any other medical problem, or you're denying access to that medical care, it's not a matter of if we're going to get into trouble, it's going to be how big.
You keep referring to the standard of treatment in the community, and then when I asked you about the hospitals, you're not sure that that's what the hospitals are actually doing. We have a rehab over here in Freedom or Effingham, and I don't know, they must have 200 or 300 people there at a time, and that is, to my knowledge, total. I think they use MAT for the 3-day detox or whatever, and then it's abstinence. And those people go out into the community. Now, I don't know, but I haven't heard of any of them ending up dead. But that's I'm thinking that this isn't a decision that we can make in an hour. I think it's something that's going to take some real investigation, especially into our local community, and to find out what kind of treatments they are doing and how prevalent the methadone is. I mean, methadone is a daily trip for anyone here in Carroll County on methadone. They have to be going all the way to Dover. And I don't know if there's any way at Dover they can tell you how many people come from Carroll County to Dover.
They
Or
cannot
not.
release that information because of.
They can't release names, but I think they can release numbers of residents, because we have a facility that gives us numbers of county and state, not county, state, towns, right? They give us the number of people from towns, Ken, that they're treating.
I'm
Yes.
gonna point out, again, we can go round and round about what one person thinks and what another person thinks. It's just like.
I just want the facts, I don't.
Well, I'll point out, it's just like cancer. So, patient gets diagnosed with lung cancer, and traditional medical therapy that is provided is some type of surgical therapy, chemotherapy, and radiation therapy. There are a subset of patients who do not believe in that, and they will go and they will take their multivitamin or get their chelation therapy or get their non-standard therapy. That is their choice. That's not a decision for us to make. Our job is to provide what is generally accepted in the rest of the state, regardless of, unfortunately, the restrictions in the community. Yes, we will need to work on, potentially getting, if patients can't get access in here, yes, they may have to go to Belknap County for follow-up. They may need to go to Manchester for follow-up. But that is their decision. But we're talking about something that is generally accepted to be the standard of care for treating this problem. And by deviating from that, we're putting ourselves at significant risk.
I think Superintendent Gray
But
wanted
is
to
it
add
the
something.
standard of care for Carroll County?
There is no difference in standard of care for Carroll County or Belknap County or Hillsborough County.
You have something?
Yeah, the American Society of Addiction Medicine is pretty influential in terms of the standard of care, and they've actually updated all of their levels of care based on the use of MAT. And there are multiple at least 6 Suboxone providers that I'm aware of, and there's another one, a treatment center that I believe is going to be starting Suboxone later this year. So it's starting to actually expand in Carroll County because it is the standard of care for opioid use disorders. So more and more people are starting to do it here.
Okay, that was the American Society of what?
Addiction medicine, ASAM.
Superintendent Gray has some stuff to add too.
Madam Chair, your concerns are extremely valid. Those are the same concerns that over the years correction superintendents have had, especially with Suboxone being one of the most, the contraband issue with Suboxone is prevalent throughout the jail system in the state, in the prison, and probably nationally. So for me to start passing out Suboxone in my facility is kind of, concerning, to say the least. For me, the court ruling in Maine that made a determination that somebody with an opioid use disorder is now considered to be disabled. And so now, if I have someone that's disabled in my facility, regardless of what the disability is, they fall under the guidelines of the Americans with Disabilities Act. So if the federal government all of a sudden is saying that somebody with an opioid use disorder is considered to be disabled, I'm almost obligated to provide the appropriate treatment. And right now, the appropriate treatment looks like MAT. Doesn't mean we're going to be passing out Suboxone to everybody. There's a 17-page addiction severity index that we go through to assess these people. So the people coming in off the street that are already in a Suboxone regimen, we can continue that fairly easily. I have a partner in Belknap County. They work for Lakes Region General Hospital. They have a substance use clinic, and I've met with them. That process would be fairly simple. The problem for us becomes the person that comes in that's actively using opioids in the community. What are we going to do for them? So historically what we've done is we put them on protocol and get them off. We treat their withdrawal symptoms and we do abstinence. We follow that up with the counseling and everything else that's available in the jail. And for our sentenced offenders, we have a treatment program and we have a lot of options in my community to do a handoff to help them. But the fact of the matter is now the courts are also saying the appropriate treatment involves the medication-assisted treatment piece that we haven't used in the jails. I've talked to some of the other counties. You know, Merrimack County, I think, is actually providing MAT for about 12 inmates. Cheshire, I believe it's around 8 to 10. And the state prison, with thousands of prisoners, have 52 in their program as of last week. I spoke to the medical director.
Is that Suboxone?
Mostly Suboxone, yes, ma'am. So right now, for, you know, the county being held liable for a wrongful death upon release of an inmate, that's my concern right now. You know, we've basically been put on notice that if we have an inmate that we knew or should have known that had an opioid use disorder, and we didn't provide MAT, we could potentially be held liable for a wrongful death lawsuit if that person ODs. Some of the studies have shown that people in an MAT are up to 85% less likely to die of an overdose upon release if they're in a medication-assisted treatment program. And, you know, that program does include the Suboxone treatment or maybe some other medication that's approved by the FDA. There's also the treatment piece and the counseling piece. And if that person's not going to be involved in that, they're not going to be in the program. And that's going to be documented. So the county's liability will be covered. Also, like the doctor said, you know, some of these patients, inmates, whatever you want to call them, they may not want this. And talking to the director in the prison, it seems like a lot of them, they don't want to be involved in the treatment piece because there's a lot of effort on the inmate's part. They have to participate, and they have to participate meaningfully to be involved in that. We're not just going to pass out meds and just let them do what they want. They're going to be involved in this treatment as well. And if they're not, they will not be receiving the medication. We'll put them back on protocol, and that's how we'll deal with it. We're also going to make sure before they leave, they're going to be signing a waiver form. If they opt not to participate, we're going to document that for the liability and the safety of the county upon their release.
Would you get me the copy of the study that says that they're 85% less likely to OD if
was
they're on
referenced-
MAT?
Did you receive the letter from the ACLU, ma'am?
No.
It's
Yes.
referenced in there.
I think you have it over there at some point. Maybe you guys copy this, so I'll give it a copy.
No, you did this, this one. That's all you gave us.
You got this months ago.
There's a reference to the President's Commission on Combating Drug Addiction and Opioid Crisis. New Jersey's Governor Chris Christie chaired that commission. And they're saying that the study individuals receiving MAT were 75% less likely to die of any cause and 85% less likely to die of drug poisoning in the first month after release. So
And that was weird.
That's an
That's in that packet you
it's
just
on
gave me.
page 3 of the ACLU's letter.
And unfortunately, in medicine, I mean, the fact that the ACLU is putting out a statement that you are not providing medical care to acceptable standards in the community, they're putting you on notice. That's concerning to us. I mean, you know, it's already very hard to practice medicine in a correctional care environment. When I started 10 years ago, we could easily access medical insurance through the state system, but unfortunately the government decided to terminate that, and telling us that yes, there's easy access to medical malpractice insurance in the community. Guess what? There isn't. We were almost out of business last year, and we could not get medical malpractice coverage. And you're talking about something, I've never had a lawsuit, ever. And I could not get medical malpractice. The medical malpractice policy writers, they consider jail medicine to be the highest risk of medical care in the community. There are multiple insurers. As soon as you say correctional medicine, no discussion whatsoever. There is nobody in the state of New Hampshire that will provide medical malpractice insurance if you're working in a correctional medical situation. None.
So where did you have to go to get yours?
Out of the country. Well, it's London. At a huge cost. And even they initially denied us, and with retrospect, they said, okay, here, but we're gonna charge you this excessive premium. You know, I've never been sued. You know, our premiums just went up 20%. You know, it's about perceived risk, and unfortunately, that's opiate addiction, opiate use disorder is a major issue in correctional medicine, and if we leave it untreated and not providing the minimal standards of care that have been provided in other facilities and is considered to be the standard of care in the community, we're gonna get into trouble. I mean,
And I think I got two things here. One, we talk about lawsuits, that's one side, people understand that. The other side is any offender inside the jail, if they don't like the care, say they're not getting what they want, all they gotta do is write a letter to the Board of Medicine, which costs them nothing. And then our doctors will have to get a lawyer and go fight that in the Board of Medicine every single time. So when we make decisions, if we make decisions say not to go with this, and the offender decides to sue us and writes to the Board of Medicine, they have to get a lawyer and they have to pay for that out of their pockets for the Board of Medicine. Why aren't you treating this person? So there's multiple facets that come along with this.
I mean, I'll have no grounds for defense if a patient comes in and they are diagnosed with opiate use disorder and I do not treat them. If that's referred for medical malpractice, I will lose that case. I mean, it'll be clearly lost. If that complaint goes to the Board of Medicine, I will be punished by the Board of Medicine because, again, it's just like diabetes. If I'm not providing them with what's considered the standard of care in the community, I am subject to punishment.
Well, I think we've had a very good discussion. I think we've brought up a lot of points, pro and con, to the situation. I think it needs some deliberation on the part of the commissioners. We've probably been given a lot more information today than we've ever had before on the issue. I'm sure that by next week we'll have more questions or more concerns or whatever. So I appreciate you all coming in here today and giving us an hour of your time, which is very valuable. I understand that. David, do you have any last comments or questions for them?
No, but thank you for coming on in here and enlightening me anyway. And,
I just want to point out, you guys really don't have too much time because multiple county jails have come online, are providing this service. Stratford County, we're treating patients in the last couple of weeks. Hillsborough County, they have one more meeting with their delegation and then he plans on going live. So I just want to point out, you probably don't have a lot of time to make a decision about what you want to do. The further you delay it, the more you're putting yourself out on that island and putting everybody.
We've been there before. We like to take the time to make decisions we're collectively comfortable with. Do you have any questions or
I
comments?
just also want to thank you for coming, and it was very informative, and I'm still not sure where I stand. So,
Great.
Thank you.
Thank you very much.
Jason.
Any of those reports that you could share with us would be greatly appreciated, I'm sure. Was there somebody that wanted to talk to us?
Huh?
Was there somebody that wanted to talk to us, or just for you? Oh, okay. All right. So next on the discussion is budget discussion.
Can we do the credit card real quick and then go to budget? Because I gotta get Kathy up here.
Okay.
So I reached out to all the counties like you wanted me to last week and found some interesting some interesting information. They all do it the way we currently do it. Some counties have 27 credit cards out there, some have, 7. They pretty much do it the same way we do. Some do the pay and chase, some chase and then pay, but find that they're having to pay late fees. So we're not the only ones who have been in that predicament. So that's my report for there. That's probably,
When you say I'll do it as we do it, what does that mean?
that we currently do it. One major count and sub-accounts underneath it.
Yes, ma'am.
The sub-accounts, are they in, the actual credit card that they get is, I know it's umbrella,
Yep.
but is that in their name or their department heads, or it's all under one name?
Right, it's all in one name, but you can get the credit card under your name.
Right, that's what
Yep.
that's what my initial thing was, because that way it's easier to
Oh,
tell.
I got my credit, everyone's credit card's under their name.
It
Like,
is.
yeah, like Carroll has hers, and I have mine, and Howie has his.
Everybody does. When we pay the bill, it shows.
Right, every account
individual
shows.
Shows the
Yeah.
account.
Look at the statement, you can see what each person paid.
I think maybe we just have to, if we continue with that, we just have to have some limitations on how much they're allowed to charge at one time.
And that was a thing that some had 5,000, some had 500, and some had 10,000. All depend what department was. Well, if you're IT, 5,000 you're not gonna
Right.
go very far.
Right.
But
Okay.
that's what we found out. A couple do the pay and chase, Cheshire, us, and I think, was it Sullivan that did, I have it written downstairs.
Were they happy with that?
It's the only thing that they've ever known. I mean, no one said, we hate it. I didn't ask them if they loved it.
Does it work for
Yeah, yep. As the ones that said that they switched to pay and chase, they found it a lot easier. Because they pay their credit card, they don't have to worry about late fees, and then they get the information afterwards. Others hold the department head accountable, but they still have to pay the late fees, so I don't see how do you hold someone accountable for paying it late if they're an elected official?
David?
And the pay and chase eliminates the interest and penalty. But how do you collect it? If it's been abused, how do you collect it? Just take it out of the next paycheck? You can't do that.
If the employee has the card or uses it, it's still responsible. So you can discipline an employee for that.
But you still have to, you still might be eating an illegal purchase, and then you take away the card. That solves it for the future, but it doesn't take care of the one that was the abused occasion.
No one's abused any credit cards as long as I've been here, in which I'm working on 5 years.
No, but you said you went to all these counties, and I'm just asking how they treat it when there is an abuse of it.
I didn't ask them that. I was only asked a couple things to ask them.
Okay.
I didn't get into a long, we have all their policies. And we reviewed all their policies, and, we meshed some of the ones that we liked that, we wanted, and they're right, if you do abuse it, you don't get the privilege, it's a privilege. Right.
Which I think that's good, and I think the pay and chase, so we don't have all of those interests and all of that controversy and chaos, I think that's, and I do know there was one instance where there was something that had, no, that wasn't a credit card, I'm sorry, take it back. But
So I think we've pretty much tied everything down. I think we should look at the policy one more time for next week maybe.
okay, and we found out that individual departments having their individual cards is not That's not allowed by the credit card company?
No, it is, but the department head's gonna be, it goes on their credit, and no one wants that, so I doubt you're gonna even get anybody to use credit cards.
I just think we have to come up within our policy on what extent they can use their card. I think that will work with us.
Put a limit on it.
Yeah.
And that may be determined by the departments. You know, although I hate to think of someone running up a $10,000 bill that we haven't been appraised of.
No, I
You
mean,
said one of them had a $10,000 limit.
Yep.
So I would think that,
I think that's a little much.
yeah.
well, I don't think so.
Yes, Jason?
Depending what you get, I mean, you could get a big shipment of, let's say, cleaning supplies at $2,000, $2,500, and then you have other bills that go along with it. It adds up quickly when you have a $3.5 million budget and you have to get things for all the inmates and everything else. So the credit
But
card,
you know ahead of time that that's coming.
sometimes, yeah, and it adds up though. As we purchase stuff, it adds up. So you can have a high bill some months. It's not all one thing to be accumulative where you have to go out to bid or anything along those lines, but.
I mean, you order a server, that's $7,000 just for one server.
Yeah.
But I'm not saying it goes on a credit card, I'm saying,
Yeah, no, I understand that.
right.
And I think we should continue with our purchasing agent idea. Yes, looking good. David, you have a comment? Okay.
So
Okay.
next week we'll
Finish that.
hopefully try to finish it up.
Next week. Reevaluate. Okay,
All right, we're ready.
can we do the jail revenue while she's
Sure.
coming up?
Can we have Howie and Jason come on up and then we can just go from there. So, looking at the jail revenue, it was, last week it was, I don't know, 35,000 or something like that. So I just want to give you, and Jason and I looked at it last week. I just want to give you an example of
Wait a minute, excuse me. That was on the
the revenue.
first 6 months.
Yeah.
That wasn't last week.
We went over it last week.
I know, but you made it sound like it all came in last week, but that was at the end of the first 6 months.
Right.
Yeah.
So, in September 5th of, so just last week, or a week ago,
Excuse me, Kenny, is that in this
No.
week's brochure
No.
or last?
I'm just trying
It's
to
not there.
clarify why it was only $35,000 last week, last week. I think.
First
For the
6
first 6 months. So some borders have been down a little bit, but in looking at how we receive the payment for the invoice, we send the invoice out after the end of the month. So in last week, on September 5th, last Thursday, we received a check for $10,062.50. And that was for Rockingham June female. So it took a couple months for us to get that check. Also, we got Rockingham's May female payment for $98.90 the same day. It came in at the same time. In August 8th, we received $17,193 from Rockingham for the females for April's payment. So that was 4 months later, or 3 months later, the payment came in. Stratford, $11,100 and $5,004. And that was for February and March. It came in August. So currently we have about $90,000 as of today.
$93,890.
Yeah.
Paid up till when?
September 9th.
Oh, yeah, that's September's billing isn't there yet, but.
He asked when it was paid up to, September 9th. I don't know what the months are, I have no idea.
Well, I mean, we all paid up for August, and we
No.
all
No.
paid up? Well, that's what I'm asking, where are we paid up to?
As
When-
far as
when
I
have they
see,
paid- When have they paid up to?
it looks like June.
Yeah, June.
Madam Chairman?
Yes, sir.
I don't wanna cut off our nose to spite our face, but that's not acceptable to be waiting, taking their prisoners and waiting 4 months to get paid.
It's pretty standard, because you have to still go back and through. You're billed by any portion of any day. So you have to go back and look, and it's back and forth of where the inmate was, were they at court, not at court, were they ours, not ours. There's a lot of work involved, and actually, it's not just straight billing, like, here this day, that day. You have to go back and forth where they were, did they take them overnight. It's also the medical billing that goes with it, because they reimburse all the medical billing. So it takes a long time to get reimbursed.
4 months?
It can be, yeah, and this has been standard since right from the beginning.
Look at the hospital, same way.
Well, yeah, but this $93,000 doesn't include medical reimbursement,
No.
does it?
No, this
No,
is straight,
that's
this is
strictly
straightforward.
borders.
Right. So how long does it take you to get the bill out?
At the end of, well, it depends. End of the month, Sherry can run a report, but then what she usually does is call over to the other jail, and they work back and forth to try to get some of these things squared away ahead of time. So end of the month, in a week or so, we send it out. But,
So by the 15th of the month?
yeah,
So David's right, it's still taking them 4 months to pay it.
this is, when you have the, I just will say this here, when you have the delegation on things say that we're behind and, we don't know what we're doing, this is pretty typical of every county. This is the way it is, and a lot of time they can get to stuff and figure everything out. You have 2 counties, Stratford and Rockingham County, who do it this way, because it takes them through their financial department and figuring everything out, getting it through their commissioners, getting it signed, everything else. It takes time.
I'll bet they're paying for their plumbing supplies in 4 days, like we do.
But I bet you they're not getting their ice check that next month.
No,
No?
no, federal government will take them a long time. Same as here, when we go for our reimbursement on the grants, Kathy, right? Doesn't that sometimes take months? Takes months to get our reimbursement back from the federal government. That's just the way it works. Like it or not, at least we're getting our money. We have track of how much it is, where we're getting. We do get it.
So I just want to let you know that it's more than $35,000. We have a little over 90,000.
So wait,
So halfway there.
so by the end of the year, they're still behind, so how is that show on your revenue for the end of the year? If you don't get a check till 2 or 3 months after.
Kathy has to do a journal entry back into it.
Right, there's a couple of ways of dealing with it, but if he can give me what he's billed out, I put it as an accounts receivable.
Anything else on the jail revenue?
No.
Okay. So
That's
Kathy
good.
is here for
It's the only thing that was quick.
budget discussion.
Yeah. So we met with you about 3 weeks ago, 4 weeks ago now maybe, talked about the budget, structuring the budget. You guys have had time to think about it. We want to implement it because we want to get it going here. We met yesterday to go over some of the other things that we were looking at. And we brought Kathy in to get her idea on how we would structure this. You know, the electricity, the natural gas, the propane, are you with me, Amanda? Or are you just thinking?
I'm listening
Okay.
to every word you said.
Okay.
You wanted the propane and the electricity, and I was curious as to what Kathy's
Okay.
response was. That's why I was listening.
Okay, and then it just looked like you were just in deep thought. I just want to make sure.
Concentrating
I
on
have-
what you're saying.
And then we talked about, the health insurance, the dental insurance. Jump in, guys, anytime. What else did we talk about?
On the nursing home end, we talked about getting away from the former enterprise basis that's been
Oh, yeah.
done with, where principal and interest makes sense in that model, but isn't appropriate any longer to be a department expense.
Well, we discussed this for 2 years or 3 years, why aren't we making the change?
Historically, historically here and everywhere else, principal and interest is not part of a department expense. It got put back in a few years ago, caught up in the discussion about whether Mountain View should be an enterprise fund or not. Commissioners were very clear in making Mountain View not an enterprise fund, but we didn't take the next step, which was to make the accounting coincide with that.
So whose responsibility is it? Let's get it done, because I can remember the discussion from 2 years ago to move the principal and interest into the general fund, so we have an accurate, like everybody else. What's the holdup?
All it takes is a
So,
vote from the commission.
so it would go back to the numbers that we used to use.
Yeah, we've got the account numbers, that's how it started out, it was all in the 100 fund, but it got moved out, so, and it's just been, subsequently it's been budgeted in the 300 fund, so it's easy enough to do. It's a matter of putting it here instead of here.
Well, that's what you do with the principal and interest from other things, like the water department.
Right.
Jail.
There were auditors a few years back who insisted that we create numbers in the 300 fund, so that's where it went and that's where it stayed until now Howie's asking, and I said, it's not a problem. We just need to put it in this number instead of this number.
So are you guys okay with that?
So was it Melanson Heath or Boone?
No, it was
totally?
Julio.
Julio.
Oh. Hmm.
So what do
Let's do
Melanson
it.
and Heath think about moving it?
Well, I don't think they have a problem because they're
They're the
aware
ones
that
who-
it's no longer an enterprise.
Right, they're the
fund.
ones who told us
Just
to take it
see
out
what
of it.
happened.
Well, to stop the enterprise.
Right. They said it's not an enterprise fund.
I'm just curious why they haven't questioned why it was still in there. That's, why it
They
didn't move.
haven't questioned it. I don't think they would have any issue with us moving it back to the original account numbers.
David, you were here through all of that.
Yeah. That's why I asked the question, why wasn't it done? I thought it was, and the finance comes from the finance department. We tell them what to do, and either it gets done or it doesn't.
I know this is probably a stupid question, what's the difference between the two accounts? I mean,
Cost of county exactly the same.
Right.
yeah, that's what I mean, so like,
It's just better accounting for it not to look as an operating expense, because it really is a capital expense. It's not really, capital expense when you're paying off principal really shouldn't be treated as an expense. It's really an addition to asset at that point.
Right.
Wasn't the jail in that
Used to be.
principal and interest
Yeah.
is separate?
Yeah.
It's not part of the jail's
Right,
operating budget.
And that was the water and sewer.
Well, those are the only two I can think of right off that had
Right.
outstanding
They were
things.
all originally set up the same way, but Julio moved it and it just never got changed, that's all.
So we'd like to change it back, so I think that's what we'd like to do.
That would be in the 100 fund, right?
Mhm.
Make a motion that we move principal and interest from the Mountain View community from 300 fund to the 100 fund.
I'll second that. Any more discussion? All those in favor of the motion say aye. Aye. Those opposed? It doesn't change you bring it right back when you put in expenses for the federal money and stuff,
But
right?
it does not change the cost reporting, those figures are the
Those are
same
the only
figures.
things I worry about. I don't want to pay BEAS any more money.
No?
We talked about maintenance and taking the maintenance, like about Joe and stuff, we want to talk about that.
Yeah,
So we talked about maintenance, because like even talking to Superintendent Ray out here, he doesn't have maintenance in his budget, propane, electricity, and things we've been talking about. That goes under facilities. So we talked about that as taking, if I take the maintenance line out and it's given to, say, Bob in facilities, my maintenance person, Joe, would also report to facilities. Most of your county facilities, and they have a maintenance department, and they distribute out the workers where they need to go. So in Belknap County, there's a main person that stays over at the jail, but when the facilities person needs them, they pull them back. Where I came from before, the same thing. We had a guy that came down to the jail, but when he was needed other places, they were pulled back by the facility or a director. So we talked about taking those and actually putting it into as under Bob as under facility.
Because when you look at the overall budget, we're not doing it consistently across all budgets. And that's a problem. Especially, say you were to say, oh, let's take off 10% off of the jail budget and every other budget. So 10% for Jason because he's got health insurance, dental insurance, heat and electricity. I mean, those are huge numbers. We're talking probably be about $1.25 million, $1.3 million just for that alone. And taking 10% out of the commissioner's budget would be a lot less because those aren't in there. Neither are they in the registered deeds, the sheriff, or the county attorney's office. Neither are they in the DPW.
I'm talking about because waste management is one of those things too. Waste management is not shared by multiple departments even though they use it. So waste management will go under facilities, that's where normally that is as well too. So it's not to a building because we'll take here, there's multiple departments, they all share the waste management, but they don't pay a portion of it. Where those are hit on individual budgets. Those type of things, when you're looking around other counties, are all under facilities, usually.
Yes, Howard.
And the reason for that is to gain efficiencies of scale. So rather than treat us as having essentially 3 separate buildings, to look at things from a county-wide perspective, it gets to be more efficient to have the maintenance staff and the utilities managed, for the entire campus, rather to be campus-based rather than building-based.
Kathy, on the utilities, propane, you get one propane bill.
Correct.
Do you know how much propane is used by each of the individual buildings?
Well, a few years back, they did the jail has a meter, the admin has a meter. We adjusted it, but it's divvied up by percentage.
So you don't check the meters?
I don't know how, I can't, if anybody can come up with a way of checking the meters and correlating that to the deliveries of the propane, I'm more than happy to listen, but.
The meters don't tell how much propane's being used.
Between date 1 and date 2, but then you have a delivery of propane. They deliver the same amount almost to the gallon every time.
But we pay the same amount per gallon
Correct.
for the whole contract.
Right.
So if Jason's using 100 gallons, it would just be 100 times that amount, wouldn't it?
Right, but we figured out what his percentage was in his building. So if you need to know per building, you got different things. Howie's building, this building has a meter on it. Do you have a meter? I don't think you guys have a meter. So they have the kitchen, the heat, they have laundry, they have different
You don't have a meter?
Not a separate
usage.
meter.
So,
Laundry's in the annex.
In the annex.
Is that on a meter?
I don't know that
Don't
they
think
have
so.
a meter, no.
I mean, we did put a meter in the kitchen when they were gonna put a food service, but we ended up taking it out, so.
Terry, you have a question?
That Bob told us that every building had their own meter except for the annex.
Well, you're right, he did. But you don't think they're being read?
Well, I don't really see how you can utilize such a thing because you get a bulk delivery that gets dispersed to different locations. So
But the meter should
if
tell.
he reads his meter, and we read the meter at the admin building, and you gotta make sure you do it at the same time.
Well, I would say the beginning and the ending of the year would be a good time, or the beginning and ending of the contract, because then we know exactly how much each gallon costs.
But there's not a meter at the DPW or at the sewer plant heaters.
So it gets used, and I don't see how you can we know how much we use gallon-wise countywide. I'm not really sure why it's relevant to worry about buildings, other than when we were having to allocate it to 3 different buildings, we were doing this with percentages, and we did have meter readings that we checked against it, and we adjusted and made that percentage, because I don't see any other way of doing it.
Well, particularly right now, it's important because Siemens, how are we going to know if they've made Jason's building more efficient? If we don't know whether or not the usage has changed.
That was on electricity though, right? Was it-
Right, yeah, it's not on propane.
But
Didn't they work on your roof in the outside building?
No.
Oh, yeah, we gotta do your roof.
well, aren't we talking about electricity also? If you're talking about utilities.
Yeah, but Amanda's talking about propane right now.
Right, because the electricity, everybody gets a separate bill. That's pretty cut and dry.
Right.
It's the propane that seems to be the question. Yes, David?
Other than the cost accounting for the government or whatever we do for there, the only relevant thing is how much do we use a year? And did we use 260,000 gallons at $1.07, or did we use 250,000 or 300,000 at the same price? What difference does it make? You know, this is, we can't change the amount of fuel that they use in the jail. We can't change the amount of fuel that they use in the nursing home. So why wouldn't you take it as a total entity?
Jason?
I just throw out there, when it's in individual budgets, you know, you basically have to have Bob next to me anyways, because how did you get the propane budget? Bob. How did you get the electricity budget? Bob. So he's coming to our sub-budgets, because we just turn them anyways of what percentage he says it's at. Where if it's all in one facilities, he brings to you, the county uses, I don't know how many gallons you use, times X, and that's what the budget is for propane for the entire next year. Instead of what it is now is we break it up, and Bob's still giving it to us anyways.
Right, it's only broken out because it's in 3 different budgets, that's the only reason.
Well, I kind of disagree with it, that's the only reason. I mean, it's how you tell what's going on in that particular building. If there's something that might, if they're using an extra amount of propane than normal, then there's something going on there that needs maintenance, or, I just think the reason for a line item budget is to be able to see what's going on in each department. And that includes utilities.
So how do you know, well,
So if I could throw this, so with that being said, and maybe that's the case too, how do you allocate it in the other departments as well? They're not using, it's not in their departments now. So when you're doing budget stuff, and the budget, my propane has gone up in 1 year, up 20% 1 year. It went up through the roof. You know, it was like $20,000. That eats up 3% of my budget or more right there. And then you're trying to do your contracts and everything else. But if that's not distributed amongst others, say in this building where nobody else is paying that, and their budgets go up 3%, that's great. That's straight up salaries, because they're not paying propane, heat, maintenance, waste management. So it does make things very difficult. And also when you look at other counties, that's why they're also taken out, so you can get a true cost of what those things are.
In this building, whose budget takes the propane?
it's the admin building budget, 4170. Has all the electric in it, all the heat, all the,
Okay, so this
all the costs
building,
associated
this
with the
building, okay, got it.
And really, the biggest user is probably the sheriff's office.
For electricity or?
For both. Yeah, propane, electricity.
Why?
Propane?
Why for propane?
Because they have to keep all the equipment in the server room cool, and the air conditioner's running year round.
On propane.
Well, now it is, yeah.
The air conditioning is running on propane now?
I believe so. I see the lines going out there.
I don't know, probably.
Unless those are refrigerant lines, I'm not sure.
I would
That's-
think that it would work.
That's a good question. There's gotta be refrigerant, right?
I would think it would be electric, but
I don't know.
they've got, my concern is that we need to be able to check all of this for the Siemens thing, to see if the use of this stuff is going down or not.
They're gonna go by our delivery amounts, I'm sure.
Well, I don't think they can't, because Howie didn't have anywhere near the work on the outside of his building to keep heat in that this building did.
Well, his was already done.
This is, well, that's it, but I mean, if they're saying, oh yeah, we reduced your heat, the overall use of propane isn't going to be any indication as to what happened in this building.
So then we gotta allocate to every department then, so let's do it one way, or, let's do it one way campus-wide, not, well, let's do the jail differently than everybody else, or the nursing home differently than everybody else. I mean, the DPW doesn't even pay for any propane, it comes out of the jail. So,
They use propane for heat, David?
And electricity.
How does Siemens with their contract and promised reductions, how do they figure it? Do they figure it on individual
no.
buildings or massive?
It's on kilowatt reduction.
Okay, but how about the propane?
That I don't know, you gotta talk to Bob about that.
If
I wouldn't know.
it's
I don't
on the
quite-
whole, if
I don't
it's on
remember.
all of the buildings and it's in one,
No.
then why aren't we dealing with just, to take care of your problem, dealing with propane in all the buildings? If that's the way they're calculating whether we save money or not.
No, I think they're doing it by individual buildings,
I'm not
because
sure of that.
I've got the contract and I can look it up when we go back to the office.
Well, I think in it says, and I may be wrong about it, that they break it down by the buildings, but I think they're doing it as a total at the end of the year, whether there's a savings, but we can check that. I think it doesn't make sense that they go around and say, we're gonna pay the difference in this building or that building if we miss it, if their object would be to do it for the whole complex, I would think. The total savings for everybody.
Well, we'll have to look, because I'm sure, because there was very little work done at the nursing home, whereas there was a lot of work done here, and there was quite a bit done at the jail with the boilers and things.
My guess is that they would be factoring in, an X% savings on this building based on heating degree days, and that's gonna translate into savings of so many gallons of propane that would be, for those heating degree days. And they could calculate that out pretty straightforwardly to see if they've succeeded with their objective.
I think it's all explained in that contract. I'm pretty sure when I was reviewing it, that it's in there. Because that was my question, how do we know? They're supposed to put a meter in here too to check things. Did they?
They do, yeah, it was here, they put like 5 meters in.
No, that was at the beginning. They're supposed to have a permanent one that Bob can check.
I don't remember that.
No, it's in there. I'll find it. I'll do that. Okay. So what you would like, first of all, is to do your budget outline, the way you showed it to us, comparing one year to another.
No?
I'm not quite sure what you're asking.
Well, last week you gave us a
Yeah?
spreadsheet type where you were comparing, you put down last year's and this year's.
Right, that was
6
requested by
months.
the delegation.
Yeah.
Right, and you're asking to do that?
Bob?
No.
No,
Okay, what are you asking?
I'm not asking anything. These guys want you guys to separate out a maintenance completely separate from, so you can pull maintenance from all the buildings into one budget. They're looking to pull out the health insurance, dental, so it's all in one place. That's what they're asking. I'm not asking for anything. I just need instruction on what you guys need me to, because in order to do some of this stuff, I have to add another level, and I'm working with the software people because it's gonna have to get created in order to make this work. So I can still keep track of, for example, the electricity from each department. I can't, that 061, everything can't just go into one new budget and everything's 061, because then I'm gonna lose that breakdown of all the different buildings, so I have to add another level.
So if all of the electric bills go into 061,
Right.
then you can have another level that you can print out
Right,
that will
so-
show where the actual electricity was being used.
Correct.
That's what you're saying. Can you do that with propane?
Well, we can do that with propane to the extent I can continue to do these same percentage breakdown that I'm using right now. So you'll continue to see, so if the propane consumption goes down, then everyone's percentage is gonna be, that same percentage is gonna be a reduced amount. Unless you wanna buy propane tanks for every building.
Well, no, Bob, correct me if we're wrong, but Terry and I thought you said that there were meters on the propane line for each of the buildings?
There's no meter on the annex, and there's no meter on the DPW building. The DPW building is fed from the jail's meter, and the annex is just a formula. It's a percentage.
And that's fed from what meter?
None. It's a
Straight from the tank.
It's a subtraction of the others. You have to extrapolate to get the annex.
So in propane, we're best guessing is what we're doing.
This essentially, we really are. I mean, the county as a whole uses a certain amount of propane every year, and it's just a mathematical formula that it gets for budgeting. I don't know why we do that.
So you don't read the meter at the beginning of the contract and at the end of the contract at each of the buildings?
No, we do it over gallons used. Very simple, gallons used.
The classic allocation is per square foot.
You know, look, but the nursing home has a meter,
Mhm.
and you never read it.
We read it and track it just for informational purposes, but we don't use it for anything
So
else.
you can't tell me how many gallons of propane the nursing home used last year?
I can, well, last year, it's funny you asked that, because I had to have the meter rebuilt. The meter broke down during the middle of the year, so last year would not be an accurate representation. But other years, I have tracked, and I can tell you how many cubic feet, because those meters read in cubic feet, even though we buy in gallons. I can,
Well, that's easy to transfer.
yeah, I can tell you those numbers.
It's like 7 gallons per cubic
7
foot.
gallons per cubic foot.
So you can tell us if there's a reduction in the propane use in this building this year
Yeah.
over
we're-
last year?
Yeah, we're also going to see it in our total propane consumption. If that's what you're getting at, we're going to see it in our total propane consumption, because the nursing home and the jail are two major players in our propane and electrical bills. The other buildings are pennies considering what the jail and nursing home uses.
My concern is I'd like to know how much the propane reduction was in this building and how much it was reduced in the jail over last year. That's my concern, that we be able to do that, we be able to see that someplace.
That's going to be a hard number to really put a finger on. You have to, there's a lot more to it than just reading a meter and saying, yeah, we use less this year than we did last year, must be working. You get temperatures, you get degree days that are into the equation. You have all sorts of variables that come into that equation. We'll be able to get a big picture, and we're paying people to do that for us. And this year is not going to be an accurate representation by any means. This project has to be done and finished, and then we have to go another year or two before you can actually see tangible results.
I think as you were asking for, Commissioner, is Siemens contract looking at totality or by individual buildings of savings?
I know what Siemens contract is looking for. I'm trying to find out from Bob how we can check what Siemens is saying.
All we can do, us, is get a snapshot of what the meters say and come up with our own extrapolation, but it's not going to be accurate.
But it should be indicative.
Maybe.
So I'd like to know how Siemens is, so can you tell me how Siemens is gonna do this contract?
To verify whether or not we've made the savings that they said we were going to make,
And how are they gonna do that?
it's in the contract.
Anyway, you just said you know how they're gonna track it, so how are they gonna track it?
It's in the contract. You can get the contract out and you can read it. And one of the things they're going to do, and we've paid them, I think, for 1 year, 3 follow-ups, is that they're going to come and meter the buildings. they're gonna, I thought when you were talking about metering that that's what they were talking about, but they're also talking about the electric meters.
Yeah, they'll still have the ability to do that, as will I, but they're gonna apply their science to it.
Exactly. And that's all spelled out in the contract.
Correct.
But they're gonna put meters in here?
I'm not sure exactly how they're gonna do it, and I don't wanna speak with it, you know, I don't wanna sound stupid. But they've got money on the line, so they're gonna make sure that they've met their target.
And I just want to be able to have some sort of verification that all of that is accurate, that's all.
And are they doing it on total gallons used, or not used, or purchased?
Well, all the items that were in the energy project, they're not gonna be looking at the gallons used at the annex, because we didn't do any boiler air conditioning work at the annex. DPW is gonna be hired because that comes off of the meter, they didn't do any boiler work there. So, like I said, there's so many variables.
And their individual projects are what they're going to evaluate,
Right.
like the jail and like this building.
Right.
So I'm still lost.
But-
How are they gonna get that total? Total gallons used?
Total gallons used, well, we have a meter at the jail and we have a meter at the annex. I'm sure that that's gonna be part of the equation. And I'm sure degree days are gonna be part of the equation.
And it gets complicated if we have wood chips in the mix.
That's another variable, pellets. Mhm.
Yes, I'm still not.
But I think we're getting away from the original focus of the conversation, which was budgeting,
Well, and
which
my
has
question,
nothing to do with the measuring.
well,
Well-
that's actually what we were talking about, was because I was asking Kathy if the electricity goes into one line, if then she can have a breakdown of all of that afterwards. Because the electric bills will all be put in individually for each building, each whatever. And she
We're
said
still,
yes.
that's not gonna change. It's only budgeting that's going to change. We're still gonna have individual meters. And we're still gonna have an individual report from the power company of what buildings use what electricity. So that's not changing.
Well, I understand that, but what my question was, if she put the electric all in one line, then can she have a second printout that breaks up that line? And she
The
said yes.
details, yeah.
And she said she could do the detail for electricity. And then we got on the subject of how would you do the detail for the propane. And that's when we came into this discussion about metering and versus a percentage. And she said they've been doing it on a percentage.
Correct, right. And I
And
would
then it-
continue doing that just because it's a comparison, so if you keep using the same percentage, you
Yeah.
see how it's being charged.
We can certainly start with the same percentage that we're using because we don't have a benchmark. But as.
Well,
as
that's
a-
why I was asking if you've had a reading of those meters over a period of.
Yeah, I've been tracking the meters for a couple of years. Like I said, the nursing homes meter I can't use for last year, that's just out of the equation. But since it's been rebuilt, we've still been tracking it. But we're gonna have to come up with a new benchmark, and that's not gonna happen overnight. It's gonna take a couple of years to come up with a new benchmark.
But you have the benchmark for this building for the past several years.
Yes,
You have a benchmark for the jail for the past several years,
yes,
including including the DPW.
yes.
So when we talk about propane for the jail, we have to add that it also includes the DPW.
But what I mean is the formula will change. With the energy projects that we've done here, this building and the jail are gonna be using a different percentage than the nursing home, which is static, and the annex, which is static.
And that should show up in her details for the next year and the year after.
Right.
And that's what I'm concerned, that we can still see those details and we can compare them and say, oh, yes, this has changed and it must be because of whatever. Okay. Now, the other question, which I'm curious too, is Ken said that the air conditioning runs off the propane.
No.
Okay. That ends that curiosity.
What there is, okay, we're gonna get technical here. The old system that was on the roof that did the air conditioning, okay, it's still gonna be in play, but it's gonna be working a different purpose. It's no longer gonna be the primary cooling source of the building. It's gonna be a secondary cooling, and it's gonna maintain fresh air. Okay, that's gonna keep us up to ASHRAE standards for fresh air in the building. So it's gonna run, and it's gonna cool the air coming into the building, but it's gonna be set at a static temperature rather than varying like it did when we were running air conditioning. In order to do that, you have to have air conditioning coils, and then behind that you have to have heating coils, because sometimes you have to reheat cold air to dehumidify and not overcool the building. Those heat coils are driven by propane.
But that's just in the old units.
Just in the old units, which is still going to be functioning, which is still going to be reheating partially by propane, but just not to the degree that they were
That was.
primarily.
Okay.
I knew there's propane in there somewhere.
Yeah,
It wasn't.
yes.
Okay.
Thank you for that clarification. So we're back to, I guess, the question is, if we put propane on one line and we put electricity on a second line, the details for both of those two lines.
Which I have reached out to our software people to ask them to add another level. That's gonna have to be built. So I don't know, I haven't heard back from them what's involved, whether I can build it myself or if I need them to build it for me. But that's what I asked them. As soon as these gentlemen told me what they were thinking of doing, I wanted to have a further level for that detail, not to get lost.
You have a comment, David?
No.
I think it's more than just those two lines. It's more than those two lines. We're asking propane, electric, the waste, maintenance, like my maintenance budget would go over to Bob. He would have the maintenance budget for the jail. And then even my maintenance person would also go under Bob for him to be able to distribute as he needed. So that's kind of the bigger overall arching plan we talked about.
A new budget, completely new budget, not incorporating in his existing environmental services budget. That might pull some other stuff out of there into this new, completely new budget. You need a whole new department.
Because you'd be putting the same stuff in there too, over to that same department. Correct.
So pull stuff together from these 3 different buildings that are now getting the hit for all these major things that departments within each building is not getting hit for certain things because there's a hit to the buildings. So if we can pull it so we have a separate budget for all these things so that we don't have to have these 3 buildings hit the way they've been hit.
So is this the new facilities budget?
Right, that's what we're talking about.
Would that take your maintenance budget out of the nursing home?
Yeah, it would combine them all into one. That's the whole idea, is to consolidate and simplify.
Okay, but see, the consolidating and the simplifying, people can't see what's really going on. So if we can do the detail and have the detail printed out, especially for the delegation during budget times, I think that's the biggest problem or confusion here. Because remember when you put everything, jeez, you combined
Housekeeping and
laundry and, yeah, and it was like, if somebody had just printed out a detail of that for several years, I think there'd have been a lot less confusion, but that caused hours of discussion.
Yeah, but it has, the details are available anytime, and anybody can see where they've been allocated at any time. But it makes everybody's life a lot easier if it's one line that we have to track and manage than to have 4.
Kathy, how hard is it to put the budget on the internet, on our website, and with details? With details. So if they want to look.
I don't do anything with the website, so I don't really know. A detailed thing would be a huge, huge document. So, because there's a lot of stuff on there that you can't have part, you gotta have it all or none, so there's a lot of information there, so.
It's at least a ream of paper, 500 pages.
Well, no, but I'm not talking about printing it out, that's why I was thinking about putting it on our website, so that if they went to electricity and they go, well, wait a minute, how much is something else using, then you can hit a button and you get the detail just for electricity. Or,
Well, you can't, no, we don't have that capability. You can't just pop it open. We don't have that.
Yeah, you have to put it all detail out on
why
one
not?
box.
I don't know the answer to that.
You might ask them when you're doing this, because you're going to be able to have the detail in your system.
Yeah, but that's
You're
a
gonna
separate
get-
run though. We can't even just push a button and see the detail allocated to that line.
Right.
Other counties can't do that either. so
We have to
it's-
run a whole report on just detail.
You're looking for a live feed.
Even live feed you can't, we
Right.
can't do it.
No, I'm just thinking,
What do you
it's
call that? You put
it's perfectly possible, and probably you should have it in your system.
It's what?
If you talk to the people
Right.
that are making your system that's helping you with it, and tell them that you want to be able to look at electricity, get a button, and see the
Well, our
details of that.
system does not do
URL?
that. You
What?
have to run the
URL?
details, if that's what you want to look at.
Maybe a link.
You can't just pop up, you can't just click on it and then pop it out.
Yeah.
They do that in QuickBooks, but
I know.
I don't think it's a safe thing to go to QuickBooks for county
How-
government.
Well, no, but they should have one of that similar,
I remember years ago, one of the bigger problems we had with the delegation is they couldn't ever get their hands around computer expense because it was spread out through all the different departments. Bringing it together under IT really, I think, gave them confidence. They had a clear number of what IT costs. That's pretty much what we're looking at, campus-wide idea of what IT costs. We're looking at doing the same with facilities, so that all the facility expenses aren't going to be distributed all around where it's going to be hard to find. It's all going to be there in one spot, so it'll make it easier to compare year to year. It's not going to hide anything, because the detail will still be available. You know, for anybody who wants it, the detail is there. But for the bigger picture look, it'll allow an easier snapshot at exactly what's going on. We're looking at trying to be campus-based rather than building-based. And because, you know, even though we have 3 buildings, we have a number of different departments here that don't share equally in the overhead and maintenance costs. You know, Sheriff's Department doesn't have to worry about their heating costs. They don't have to worry about their electrical costs. That's not charged out to them in the way that it is to other divisions. And yet it's still a very real and significant cost, especially when things get allocated out by percentages in terms of, hey, look at percentage increase. Well, Jason and I have percentage increase on the things we don't control. Cost of propane, cost of kilowatt hours can be significant. And we have to pay for that in a way that other departments, it's absorbed by administration and not by the individual department. And rightfully so.
where do you take David?
I don't understand why all the discussion, frankly. I think is how we just clearly said we ought to be campus-based on the things that we can be campus-based on. Electricity, propane, maintenance, health insurance, retirement, the whole works. And then the rest of the stuff, I don't know what you do with, but it looks to me like the way to go is to have it campus-based where we can. Then you don't have the departments arguing about percentages or us. Well, the only problem is going to be with the delegation. They're going to insist on wanting more information, which if we go to campus-based, they probably won't get it unless we want to go through hours of bookkeeping.
Well, no, the details will be there.
Yep.
There's no added bookkeeping, because the details.
They're already there.
They have to be there.
Right.
I'm just wondering how to make it easily available. That's my question.
Well, I say they're gonna be there in the sense that somebody's gonna have to figure out the percentage or read the meters or whatever you do, where the campus-based, it's the whole thing. I'm sure we have to have the details in order to put the budget together, but, but breaking it down is gonna take time, whether we have the information or not.
So would outside maintenance go under your facilities? And is facilities going to need a new department head?
Again, that's up to you.
Because that's adding an awful lot.
Well, and I think it's better because we've got more people that can plow. We've got more people that can mow. We've got more people that can respond to different areas. You know, I think the jail's unionized, so I don't think there's an issue there. The only issue that might be is here. We'd have to talk to the union about it and see what they think, but, you know, I don't know, I think it, you know.
Not all your employees in the union?
Yeah, nursing home.
No.
Joe at the jail is not, and Bob here at this building is not.
Yeah, but I'm saying the building is, so union with union, you know, I don't think there's an issue at the jail. I do think there might be an issue here, because there's no union over here at all, except for the sheriff, and that's not really.
So then maintenance would no longer fall under the nursing home?
Well, it has to.
Why? It's not going to be the nursing home.
The maintenance director has to fall under the nursing home administrator, as far as I can remember, for life safety.
Somebody has to be, but it'd be kind of like John with IT, it could be Bob with facilities.
Yeah.
So in the role of the facilities, it still have to be responsible for life safety, no question.
Yeah, it's somewhere in the regs,
But
I
it
remember.
would be a whole different department now.
Not unlike it is in other counties where, you know, facilities is a freestanding department.
I mean, I know this is a lot to take in, so I'm not looking for an answer today, obviously.
Because I did a lot of research back the first year I was here on things like plowing and grass mowing and all of that, and I surveyed all the other 9 counties, and I can't remember. Some of them did it under each building, and some did it, I think, under some other department. So, but I'd have to check on that to find out for sure.
Some of the
To
counties
review
are
that.
spread out. In Coas, the nursing home is not
This-
part of a campus.
yeah.
And they got two.
They got 2 of them, yeah. And I think that was what some of the stuff, but let me review that and give me some, at least make some time, I don't know. You got any questions for them about this?
No.
Meanwhile, you can find out how easily you can make that detail
Right,
available.
that's what I'm working on already.
And, I may talk to John about that too, because we were talking one day about how different programs work, spreadsheet programs, et cetera. So maybe he might have some facilities. You got any more questions, David, on it?
No?
I expect we'll probably get some questions from the delegation on this.
Well, that's one of the reasons we changed kind of the format, was so that, to help them be able to compare.
I remember the commissioners submit the proposal to the delegation.
Yeah, but we can change the items in the budget.
Oh, absolutely.
Yeah.
They just vote it up or down, really,
The budget.
or no.
Madam Chair, can I just ask, on the delegation part, when new accounts have been created in the past, sometimes you lose the ability to look back 2 or 3 years, you lose the history. Is there a way to preserve that?
Well, if we can do the detail, that's what I'm thinking is, in order to compare Jason's budget this year without electricity, we have to go to look at the electricity line, look at the detail and see how much went to the jail. And then that would have to be used to compare the electricity line in the past to the jail, or the propane line, or the maintenance line, or whatever. But you gotta be able to look at that detail and check it out. And I know that there's been a lot of questions about the detail on the salaries, because maybe when you first came here, you put salaries in different buildings under one category or something. Something changed, and now you don't get detail.
We always get detail.
Jail administration, for example, it used to be separate lines. I think that's what she's talking
No, that was, since I've been here,
Has that
so
always been one?
that's been always.
Nursing, we, M&As to LNAs, we extracted that out of all nursing, so we have supervisors and line staff now, basically.
about. Sorry, I thought that's what she-
And then
Little
we-
tweaks, just whatever.
But the detail's always there.
Right, when do you think that you might have some sort of help from them?
I don't know, I reached out yesterday or the day before, I don't know anything else, but I don't know, he told me he's looking into it, so.
All right. Anybody with any other questions or comments on that? Okay. Oh, I'm all lost now. Are we all done?
Yeah.
A hire, not homework?
No, we haven't got, we just,
I don't know, I keep sending you away, but you keep coming back.
Yellow
I feel like
folder?
a bad pen.
I'll be just down the hall if you.
Thank you.
And I had a couple updates too.
Did you have hirings?
No, I have updates now.
Oh, okay.
Information.
well, let's do the yellow folder first. Howie, thank you very much. Kathy, thank you very much for coming up.
We only got one thing, and that's subsurface systems bureau application for individual subsurface disposal system, Carlton Way. I guess there's another house going up.
There's 2 there.
Wow. Well, this is a request for a leach field, I guess, so. They've submitted it on Carlton Way. This is not an authorization to proceed, just notification that it's been submitted.
An FYI?
Yeah.
Okay. That's all?
Yes, ma'am.
Okay. Administrator updates.
I got an email yesterday from the auditor saying that that there's a Mike Campo is going to be hired in coming year. She said that Joe Costello left her a voicemail saying that he's hiring Mike Campo.
I think that's a mistake,
Okay.
unless you've hired him.
No. I did talk to Alan Pennington. He sent me an email about, they can provide someone for $95 an hour and travel, we have to pay travel back and forth to Meredith.
And that's a short-term
I guess, yeah, I guess.
emergency backup type system, right?
Well, yeah, it's, she said that she would oversee it. I don't even know what, he says that she would oversee it. I don't even know what that means. So they're not gonna be doing work, they're just gonna oversee it?
You know, I think what the what Joe's been trying to do is come up, I had promised that if we were to find somebody to work in the office, they would be an asset, not a liability, and to come up with somebody that has the background and has the knowledge, et cetera, that can walk in and be an asset. They don't have them growing on trees, you know, so he's been
Oh my God.
doing a lot of research, trying to find people that would do that. Yes, David?
I have several questions about this. Number one, did we ever vote on having someone come in and help Kathy. We had Joe come in here and he talked to Kathy and she was all in favor, and I talked to Kathy before I came up here that day and she said, no way, I don't want somebody here. I thought we came in here and decided that we'd do a little more research before we voted whether we were gonna have anybody in here or not. Am I wrong or right?
No, you're correct, and that's what's going on is the research.
Okay.
Now, when I
Now,
talk,
wait, excuse
sorry.
me, I have the floor. We didn't vote on it. So how does Mr. Treasurer get the authority to hire somebody to work with Kathy?
I think that was just stated, he doesn't, he didn't, and it's just doing research, trying to find somebody that's capable of walking in and being an asset and not a liability.
Well, the email I saw today, I think it was from Joe, wasn't it, Kenny, saying,
No, it was from the auditor.
it was from Cheryl, that he was gonna be coming to work here. But what did Joe say? Joe wrote
I
and said,
didn't ask Joe anything.
didn't you get an email or something, and it was a one sentence email down there you showed me about?
It said what I just said, that Joe Costello reached out to Cheryl and said that this Mike Campbell guy is gonna be starting. And I didn't know anything about it.
Well, yeah, okay, that was the one I was talking about.
But that doesn't,
That
Joe
was,
said
that
Mike-
wasn't part of a long email. That wasn't a separate one-liner, was it?
yes,
It was.
yeah,
From
So,
whom?
Cheryl Burke.
Madam Chairman, do I have the floor or do you have the floor?
You have the floor, but I haven't,
Well, you've
I have
interrupted
none
me
of this.
15 times in the time I've been trying to ask my questions. Go ahead.
I don't have the information you have, that's the problem. And I'm thinking I do and I don't apparently. So he has a one-liner from Cheryl Burke that I never saw.
I think, if I may, Madam Chair, we all
Well,
have to,
David's got the floor, so,
No, you go
well, I
ahead.
answered your
When you-
question, that was all.
When you guys are out of gas, I'll ask my
I would guess.
When you have this private information, I wish you'd share it with us when you start
I
talking
come
about
in
it.
here every day and I find out what's going on. That's part of the job.
I asked
And
Terry
you-
this morning when she walked in if she knew
And
anything about it.
she.
And I said yes.
She said she did.
One from Cheryl Burke, but not the one-liner that says, Joe says that Mr. Mike is gonna come to work here. You just said what the email said.
This all goes back to that email that she sent yesterday to everybody. And I said, oh, I didn't know about this. And she said, and then she sent me an email back
Right.
saying, Joe left her a message saying that Mike Campbell was gonna get hired. So I don't even know what that even means.
So
That's all I said, and now it's, I mean,
Well, I think we're getting into the he said, she said, so, David, go ahead.
I read it and it said, Joe says Mr. Michael's coming here to work. To me, that tells me that Joe gave somebody the authority or took it himself to hire Mr. Mike.
Mr. Mike.
And my question is, where does he get the authority if he hired somebody to hire him? I thought that was our job.
Well,
It's
since
not
neither
Jeffrey.
of you asked Joe about it and Terry did, would you like to hear what he told her?
Yes.
I got the same emails that you all got. And I called Joe last night because I was concerned we didn't know anything about hiring anybody. And it's, my recollection is that we gave Joe permission to start looking for somebody and to find out prices and if there were people available. And he talked to the auditors to see if they knew of someone. And it was my understanding that she gave him the name of this Mike
Campbell.
and the company that he works for. And he called and talked to them. But Joe told me he had in no way has he hired anybody or even given anybody any inclination. So I think there's just a misunderstanding between Cheryl and Joe. She just assumed. I don't know.
That answers my question. Thank you.
So,
It
That's-
said, Joe Costello left me a message this week that he will be hired to assist. That's all she says.
I think that's just I don't know, because we should have brought this up when Joe was here, so he could have spoken for himself, but I didn't know, none of us knew he was leaving early. Okay.
So does that solve everybody's issues? Or anybody's
Yes.
questions, or?
So is it a sensible conclusion that nobody has hired help for
Anybody.
the office?
I sent Alan, does he want to know what our system was? Because Joe told him it was ACS, but he couldn't find it on the internet, because it's not ACS, but I did direct him, to the Conduit website, and he said he found it, and he was, grateful for it. And then he sent me a big, long email about the woman for $95 an hour and travel time, and a little biography of herself. I didn't know where we were in the process, so.
Is she capable of, does she understand our system?
No, she's never seen it before. But-
So it's not ACS?
No,
It's
it's,
Avenue now, right?
what?
Is it Avenue?
Yeah, it's Avenue now, but they bought out Conduit, so it's actually Conduit. Conduent,
ENT?
yeah. And Avenue bought out Conduent, and it's called Government Financial Software, and so he was able to, see it and.
So that's why the investigation, and we asked Joe because he knows more about it than we do, or certainly I do. Okay, any other administrative updates? Did you follow up with DOI about the pilot?
I did not, I haven't had time, I've been spending 2 days on 91A requests, so, I think I'm gonna have to call Liz Bailey on that one, on a couple of them.
Terry?
Yep, if Ken's. I did do some work on the pilot, and the only thing that is left to do, I spoke to Linda Kennedy, who is the supervisor of the
Yeah, right.
lands, right. And she said they have the thing that went to DRA, that does stay with the DRA. The only thing that we need to do, because we are the governing body of Hale's location, is we have to send a letter to, what's her name? She's the Land Bureau person. I have her name here. Yeah, Pilot Program Manager, U.S. Department of the Interior. A letter requesting that the pilot money be sent directly to Hale's location. And if we want it to go into their, and what bank account, if it comes through the bank, or in care of the selectmen. So it's however you want to receive the payment. Do you want it to go directly to Hale's location? Or do we want it to come, to Hale's location, but come to us? The check made out to Hale's instead of the county, and it goes.
But does the Hales have a pilot? Did they apply for a pilot?
They have now, they have that application. There is nothing that goes to the Department of the Interior.
And that's not what she told you.
I'm sorry, I was looking at another email, what?
I said, there's nothing else that goes to the Department of the Interior other than the request for where the payment goes. They don't get it, they don't receive an application. They will, when they get a thing, they will call DRA just to confirm the acreage. That's,
Well, I knew the application stayed with DRA.
Yeah.
I know they didn't send them anything.
no,
So we're still at the Department of Interior needs,
a letter from the governing
no,
body.
only if there is money available for Hales. What we haven't done is establish the fact that Hales has done the application and there is money for Hales.
Yes.
How did the lady in Conway go about getting Conway's?
This is what she did. And there is
Application.
no, oh gosh, I think I have another letter here somewhere. As far as the Department of the Interior feels that it should go to Hales, and that's what the lady Linda Kennedy told me from DIR.
But you didn't contact the Department of Interior?
We have to do that as a board.
Well, and that's what we had asked Ken to do.
I got an email from Kathy Golding over the weekend, just to let you know that she is closing the office.
What did she have to do with a pilot for North Conway?
That she's closing the office September 14th and the 21st, so Hales will not be open those two Saturdays.
Okay.
And she's still working on the pilot. And she put out the RFPs for ambulance service and the statistical update for the assessing. She has a deadline of September 27th for the RFPs. So she's trying to contact the Department of Interior.
So well, that's what Linda told me.
Is that the lady in Conway?
And no, that's the lady at
DRA.
DRA. She is,
Linda Kennedy.
yeah, Linda Kennedy. She's the DRA Certified Property Assessor Supervisor.
But how did Lily up in?
That's just what she did. She went through Linda.
Okay.
And then she sent the letter to the other one, what's her name? Diona?
Yeah.
Diona or something? Yep, to the pilot program. And requested that the check be sent directly to Conway. So Linda told me that's what we need to do, because we're the governing body of Hales, send a letter of request that however we want it dealt with. And when she gets that, she will, I believe the process is she will contact DRA to get the exact acreage. But DRA feels, according to what Linda told me, that it is definitely should be going to Hales. That's all I can.
Yeah.
I hate to throw a wet blanket on this, but we haven't even voted on it.
No, I know, but I think that's what they want to get this settled.
I think that should be the first thing we do. And then we go from there and follow the instructions.
Well, somebody needs to contact this owner again, because she told me the application has to be submitted to the Department of Interior, and it has to come from Forest Service or something. So that's why I wanted Ken to contact her and see what she tells him. That it's through the National Forest and something else, I don't know.
I mean, shouldn't Kathy Golding do that? I mean,
Well, Kathy can do it, sure.
that's her job.
Yeah. Is she doing it?
She said she's contacted, she's still working on a pilot.
Okay.
I don't know what that means.
You know, if this is a bigger can, we could probably kick it down the road for another 2 years. We went up there, I don't know about what you did from when we were up there, but I called DRA 4 times, and I called or emailed the people up at Hales, and it came down, if we're going to do it, is whether we could do it, and DRA wrote back and said, yes, we can. So if the check comes to us, why can't we do what DRA suggested and put it in, if it comes to us, put it in our account and then vote to transfer it to Hale's location, and then we're all set. I don't know why we're either at this point stumbling around the Department of Interior, who obviously doesn't want to admit they've made a mistake or don't wanna go on record of telling us what to do. The money belongs to Hale's location as far as I'm concerned, and I'm gonna support it that way. And I'd like to see it get done. We've been kicking this can now for a year. And we looked up like fools when we got up there and couldn't tell them what happened in the last 6 months, when they have, or the last 6 weeks or whatever it was, when we supposedly sent some application into DRA.
Well, because Terry called DRA and DRA told her that we have to write a letter to the Department of Interior. So maybe we should let Kathy have some more work on this and see what she can come up with in the next week or two. I don't think it should go very much longer, because we need to get all of this straightened out. You know, Lily up at Conway was able to get money for Conway the way it was supposed to be. And I'm sure that Kathy, if she continues, or with our assistance, will be able to get money for Hales, however that's supposed to be. And I think Ken's right, if that's Kathy's job, let her do it. We'll just have to keep reminding her to stay on it, but it sounds like she's on top of it.
So she said, she's still working on a pilot, but I don't know what that means.
I'm sorry, I disagree with you, Madam Chairman. I think that we're the selectmen at this point, and we're responsible, and we should get it done.
Just as soon as somebody can get some clarification that that's what's supposed to happen. And
Okay.
we're getting different stories from everybody that talks to DRA. And the Department of Interior told me a different one, so.
Well, we've got the money, so, or
Oh.
hasn't the check come in for?
Yeah.
We've got the money, it's our decision what we do with it, and we're not doing anything, we're kicking the can.
Well, I make a motion, we give it all to Wolfboro.
I don't second
You get a
that.
second?
Well, there, of course not,
No.
because
Well,
we
then,
don't.
I'll make the motion that we pay the pilot money to Hale's location. Now we'll have a serious one, and you can stop looking like the joker around here. Go ahead. Anybody want to second it?
Can we do that now? I mean,
You can't, unless it's a second for discussion. You shouldn't talk about it.
well, I'll second for discussion.
Well, there you go, you said it.
Okay. I think the acronym pilot is very clear. It's in lieu of payment. The government owns the land, and Hales can't tax it, so they send us money. And yes, maybe we should write a letter and say, in the future, please send it to Hale's location. Well, we got this year's payment,
Right.
and it ought to go to Hales. You up there said you wouldn't do it, and Terry was in Africa, and I said I would, so make a decision.
I said I wouldn't do it until I had some verification that this money actually belongs to Hales. It's the same way with the Conway, until I had verification, and I still didn't vote for it, because I never got verification from actually the person that wrote the check, the Department of Interior.
That's correct.
And I still feel the same way about this, until we can get some verification that this is what the money's actually coming from. It is because of Hale's property. Then I think we should keep researching it until we get that.
Well, all I can tell you is what Linda Kennedy said to me, and she said, and I thought I had it written down, that it really doesn't make a difference what we do as a board. The money goes to Hales.
And the Department of Interior said no. It went to Carroll County.
So that's all I can say.
Is there any more discussion? Would you please read the motion?
Pay pilot money to Hale's location.
Well, I'd like
What
to.
pilot money?
I'd like to put on, add the amount,
Okay.
which I don't know,
I don't know.
40,000, I think, something.
Oh, no, it's more than that. Here you go.
Are you just saying this year's, or are you saying all of it?
Well, that's the thing we have to go. If you want to go back to 1999, we're talking a sizable amount. And that's what they want, because that's what we did for Conway, so.
And there's no verification at all from the Department of Interior that sent any of those checks, that any of that money belonged to Conway or to Hale's location.
I'll put in the motion $48,896.86.
Sorry, could you say that again? 48.
$48,896.86.
Thank you.
How about we,
That's gonna require a delegation
I was
appropriation.
going to say, can we say that we should agree to make payment if we can get it into the budget for next year? Because I've already talked to some people at Hales and said we may not be able to pay you this year because we have to go through the delegation for that amount of money for an appropriation. They're fine with that. They don't care when they get it, as long as they get it. And that might give us a little bit more time to get the confirmation that Amanda wants.
You had a comment, David?
Yeah, Ken, correct me, when I talked to Bruce, how do you pronounce his last name? Comeau. He said that, or I understood him to say that we had collected all of this money all of these years, and that theoretically we should have it sitting somewhere, but we don't, because we added it into our general revenue budget. And so it would require a pocket change, right pocket to left pocket, and we could do it with a transfer if we wanted to. And then, or the other choice is to budget 48,000, whatever the figure is, for next year. Is that, did I understand it properly?
No, the money that we've collected over the years is in our fund balance, and it's on our balance sheet.
Oh, that's right, yeah, you're right.
In order to do that, we would need delegation approval, and then we'd have to take it out of fund balance.
Yes,
There's no-
you're right, you're right. That's basically-
But if we do it this way, budgeted, just like we did Conway's, it's a budget in, budget out. So it's still approved by the delegation.
Yeah, we still have to go before the
Right.
delegation.
But either way, it comes out of fund balance or it comes out of, an appropriation. It's all the same. I would rather do it the way we did it last year with Conway if we're gonna pay them, but
Why?
because then it's a little more, transparent.
I think this is transparent, but,
And it also gives, like Terry said, it gives us a little more time to get some feedback from DOI if this isn't the way to go.
but politically, if it comes down to putting it in the budget next year, we're gonna get in the hassle, or you raise the budget 15%, or you raised it 16 or 18%, and we're gonna get into that politics, which is going to make the delegation people think
You can still use fund balance to offset it.
yes, you can, but we don't have the tangle about, it's gonna come in at the same time the budget it's in the budget, so we're gonna get to talk about how the budget's gone up this month, this year, or way over last year, blah, blah, blah. Where if we do it this year, and in September or November, when we don't have that agitation that goes on between the delegation and the commissioners, it might be easier getting it passed now than in March.
It's up to you guys, how you want to do it. I said what I wanted to say. Either way, you're going to have to get delegation approval.
Yes. And we still need to vote on it.
Well, there's been a motion and a second, so
Is there
Yes,
any more
Ron was there.
discussion?
I think that we should put in there with delegation approval. So we do have to go to them.
Right, either way, you have to go.
Yeah,
Are you okay with that? Okay.
please.
Would you please read back the motion?
Sure. Motion to pay $48,896.86 in pilot money to Hale's location pending delegation approval.
All those in favor say aye.
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 Those opposed, no. Okay, that was still under updates, right?
Yes. I have to contact outside counsel on some of these 918 requests, just to let you know that. So I'll be doing that tomorrow.
I contacted her on a lot of them, not all of them.
No, there's only a couple. I spoke with Michaela on some of them too, and she recommends that as well. So I'm gonna take her advice.
Jim,
Yes, sir.
I've spoken to a couple of representatives. I think somebody ought to put an LSR in that somehow the courts have the power to say enough is enough. I mean, we're expending all kinds of energy to chase down stuff that, my God, it's gonna take hours to find, and whether it's relevant or not, is questionable. And I think that I would hope somebody on the delegation would say, the least I wanna see is the person have to pay for the time our people put in for work. But there ought to be some safeguards for the person, for the entity that's being asked to provide the energy and resources, and there isn't. So I suggest you talk to your representatives if you agree with me. Our representative wants to speak to us, Madam Chairman.
It's up to you.
In public comment. Okay. Are there any more administrative updates?
I don't think so.
Okay. The commissioner updates. You have anything else, David?
Well, I'll wait to see what you were gonna do. You were chairman and you were there.
You certainly may, all three of us were there, so if you wish to.
For last night, but we went to Tamworth too. I thought you were gonna tell them about Tamworth. I just have it down if you don't say anything.
Oh,
We went to Tamworth.
right. That's all you had else?
Tamworth and Conway, we all went to Conway.
Terry, have any updates? Okay. The commissioners were invited up to Tamworth for the Tamworth Selectmen's meeting. We had I thought, a nice discussion of what we're doing and, suggestions from some of the board members as to some of the things that we might do to help the county in Tamworth. We had a person in the audience ask us to look into some sort of county-wide organization for recycling. And I think those were the basic issues. Anything else, David, you wanted to add to that?
Only that I spoke to the, I don't know what her title is, the office manager, the lady that took the minutes. I felt it was putting us in a disadvantage to invite us up there and have no idea what they wanted to talk about. And I would suggest that this board make it a policy, written or not, that if we go to a town, that they provide us with some idea of what they want to know about. And we talked about pumpkins, we talked about hay, we talked about recycling, we talked about number of rooms in the nursing home, and they were asking some questions that I don't know, it was hard to come up. I think I came up pretty close on the number of people that the jail will hold, but that was luck. Maybe I should have bought a megabucks ticket that day. And I just thought it was unfair for them to, it's not unfair is a good word, but we were at a disadvantage by not knowing what they were going to ask us. And I think if we go anywhere else, we should insist on some type of question or agenda of questions that they're going to ask us.
Well, I thought you did a nice job with an update on what Siemens has done here and some of the things we were doing here. I thought that was more of just an informational type of thing. I don't know if you want it more structured, we can discuss that. Is there anything else you wanted to say about Tamworth,
No,
Terry?
I thought it was okay. I thought you guys did a great job.
Well, you were there.
I was there. Yep. But it would be nice to know if they have any specific things that they want to know about. That way we can be a little more knowledgeable, maybe prepared.
You know, I thought the question about, a perfect example is, what are the plans and what's going on with the old nursing home? I mean, that's an example of something that I would expect him to ask or would like to have had to know ahead of time that they were going to ask, so we could give them some more specifics. We did the best we could, but we've done a lot of work over there, and we all knew the answer, but we were sort of caught off balance.
All right, good point made. And then we went to Conway last night. Three of us were invited up to the ribbon cutting ceremony for the new rec department. The town of Conway, the rec department, the people in the town, and I guess volunteers from the local area have done a tremendous job in restoring the old Kennett High School upstairs where the gym, etc. was. And I thought it was a very nice ceremony, and I was totally impressed with the restoration of the gym. And Terry can probably address it better than I, because I believe she was a student there.
Yeah, it was, and it's unbelievable. It looks like when we were there, the gym. And the only thing left to do now is they want to reconstruct the stage. So that's where we're at now, trying to get donations and people to get in to reconstruct the stage. Because I want to use that for community events also, not just for the rec center. So, yeah, they've done a tremendous job. They've worked very hard.
I've made the statement before that, usually they take a historical building and they restore it, then they put up plexiglass and all these do not touch signs. And here they took a historical building and they restored it, and it's open for all the kids, for the next generations to actually go in and play, and I just thought that was really fantastic. David?
Not to take any credit away from all of the people that volunteered their time up there, but Sutton Marshall and his wife, their generosity put it on the map. They gave, what, $300,000, out of their pocket to see this thing. Someone there told me they hired the person that's in charge of the Boston Garden Celtics parquet there on the floor, and did some other, and they didn't think they were going to be able to save the floor, and whoever this person is assured them that they would, and boy, it came out beautiful.
Beautiful, yeah.
And the folks, and a lot of it done with donations they had on the back of the program, all of the outfits that, or companies that had donated money, and then of course the marshals. I thought it was great,
Believe it or not, some of that flooring had been tiled over.
yes. They took it up and sanded it.
Yeah.
It was just, I thought it was incredible, the whole thing. Any other commissioner updates? Jason, you had an update?
Sure. Couple things. I didn't want to bring some of the doctors in here stuff because just sake of time, but I want to bring up to you some of the things that, especially dealing with the opioids and the drugs that we're dealing with. I just want to kind of highlight just in the past week some stuff that we had to deal with. And if you bear with me, I'd like to read a report and then show you some pictures. So on above date, which is in the past week, Officer so-and-so assisted in bringing a female intake. Police department arrived, Sallyport, the officer moving his weapon, blah, blah, blah. The officer felt that the person was recovering addict from Suboxone, but didn't know if she had taken anything else. When the officer moved the inmate from the cruiser, before he began to pat her down, asked if she had anything that was going to stick, stab, or hurt me. She stated no. Nothing was found during the pat search. I entered a secure area with the inmate and moved the cuffs and had her sit on the bench. I grabbed a setup from laundry, blah, blah, blah. I had her remove her shirt. Where she turned around while I was doing so, I told her to face in what she was doing. She pulled out a marijuana vaporizer pen from inside her bra, handed it to me. I asked her what else she had on her. She had removed her left sock where a small green plastic baggie fell out. I had her remove her other sock, which was empty. I asked her again what else she had in her person. She then began digging into her genital area of her underwear, pulling out multiple folded up pieces of tinfoil. She had claimed they were old and might have residue on them. Then pulled out multiple colored baggies, all about the same size. There were 2 pink baggies, 1 orange baggie, 1 clear baggie, and another clear baggie. She also pulled out of her genitalia area multiple cut up straws with white residue on them, and pulled out more straws and folded them up in tinfoil out of her backside. I asked what was in the baggies. She stated one of them was probably dope, and the other ones were cocaine. I asked her, would dope consist of fentanyl? And she said yes. One of the pink baggies, a very small amount of white powdery substance in the corner, completed a strip search, blah, blah, blah. I'll show you a picture in a second. A week earlier, we had another female come in, and I made a circle here so you can see about this size baggie of heroin that she tried to stuff up her backside. Our officers caught. This is the picture of what that female came in, had all, all in A, in her clothing, and B, inside of her body. This is the stuff that we're dealing with on a daily basis, over and over again. They try to get anything in. They're very addicted, and this is one of the reasons why we bring up why they need treatment and they need help. That's just one of the pictures, and that's the size of the baggie that was on somebody else. I just want to keep you informed that we're still dealing with this. It is still a rampant problem, and more trying to get things in left and right. It's still a big issue. The other thing I'll bring forward to you is some of the stuff that I've had to send to the jail subcommittee on some of the questions they have. So I wanted to give you an update of what I have given, that I gave to Representative Knirk, and I'm not sure if he shared with them or not, but I did send that along to him, because this is my backup data with all the housing stuff that we had to pull apart.
Was there one here for Ken also?
There should be 4 there.
Because I have,
Yeah.
whoops, sorry.
I'm sure this is what they're going to be discussing maybe Monday under updates. I assume this is the last updates I gave to Representative Knirk. like this, or you just want to read on your own?
There's several pages there, Jason. I really think that we need to digest this first. And
That's
then
fine.
maybe come back next week with questions, David?
Do you mind if we ask any questions now?
Go ahead. You have a question?
Jason, well, down here it says that in 2017, superintendents were asked for their daily average cost.
Mhm.
Did you or they, or all of you, have a sheet to fill out that shows, that would indicate that you all based this average on the same thing?
No.
I know some of them don't count their heat and electricity and
That's what that's what we talk about. I'm sorry, it's stapled wrong. It's in the back page. No, they're all different. All different. You know, Blount County, no heat, electricity, no maintenance. Carroll County, we have all that in there. Coos County, I'm not sure. I know Rockingham did not report, but they don't have heat, electricity, and maintenance in theirs. Each one's different. It's just like, it's so hard to compare. If you go like to Grafton County, they raise all their food. Their meal cost per day is like $1. Compared here, it's $3.15 per meal. So yeah, it's very difficult to even compare back and forth of what you're actually truly looking at.
well, I would say to you that I would consider that a fair comparison. They raise their food, we buy our food. No. If we raised our food, maybe our costs would go out. If they got rid of their gardens, maybe theirs would go up. I would consider that fair. But I wouldn't consider fair if they, you know, you all have to heat your facility, you all have to air condition, and one has that in and the other doesn't. I would consider that very unfair.
Yeah, and with that being said, our numbers are not bad compared to what people have in their budget, don't have in their budget, we have in our budget. One of the reasons why I'm trying to look at changing things to be a little more consistent. But when I even, I'll let you guys read through it. There's a lot there.
Can I ask one more question, Madam Chairman?
Certainly, David.
Maybe Jason would want to answer it next week. Jason, how do you figure out in a cost like that when you have a whole bunch of inmates and you put in a whole bunch of hay and you sell the hay and the hay goes into revenue for the county, but it also offsets some of your costs, your net costs of having an individual in jail. And that doesn't get figured in there either.
For our revenue, for the jail revenue, you do subtract the jail revenue from our costs, not the hay, but our jail revenue is subtracted from there on. So, and then there's still debate on some of the jails subtract the grants. Grants are considered also part of revenue, and they subtract that out as well too. Some don't.
So there's nothing in here.
Nothing consistent. And when I contacted the National Institute of Corrections, because it used to be easier to kind of calculate things, take a total budget, divide by average ADP. Because we have more ins and outs, I mean, quite literally 4 in the morning, 4 in the afternoon, in and out, that doesn't work anymore to actual costs. NIC has no formula that really works, and it's something that's being talked on a national level. How do you actually calculate with the things that have changed? So there is no standard. That's just not New Hampshire, that's across the country.
So our cost of $153.67 could be somebody that came in for 4 hours and left, or somebody that's there 24 hours a day.
Sure.
Wow.
But when you look at real costs, I mean, it's really $3.15 a day per meal. If you said one-time cost of clothing, maybe $20, but it's not. Because your building's gonna be open, your heat's gonna be there, your electricity's gonna be there. Skeleton crew, staffing is not overly staffed, as Commissioner Bevard saw. So it's one of those things. And it says in here, you know, we're the second smallest, even with heat and electricity and maintenance in our budget. Okay, compared to others, we still have the second smallest budget in the state and the third highest revenue. So for little Carroll County, we're doing okay. And if you take out some of the other factors that other ones don't have in there, we look even better than where we're at.
Why do you suspicion that Rockingham, Stratford, Hillsborough, and Cheshire, 3 of the biggest out of 4, didn't even report?
This was an article that came out of Laconia Sun in that year. And at that time, when they did the article, it just hadn't reported at that time. So that I took right out of the newspaper.
Okay, I think we have non-public statement.
I just want to make sure that you're all aware of the meeting on Friday, the Hampshire Association of Counties,
Oh, yes.
What time are you leaving?
8:30. It's being held at Merrimack County Courthouse.
The old courthouse.
Yeah.
It's changed, isn't it?
No, Merrimack County Courthouse.
No, but what was the email we got?
The officers' meeting's been canceled.
Something for tomorrow, for Friday was moved to some other day.
Well, this was supposed to be last Friday, and it got moved to this Friday.
But I thought it was changed to Concord,
Yeah, it is.
not Merrimack.
Merrimack County Courthouse is in Concord.
Oh, I thought it'd been up by the jail looking for it.
No, downtown.
Thank you for that.
Want me to read this? Madam Chairman, should I read it?
What's that?
Non-public, you want?
Yes, please.
Make a motion that we go into non-public, session 1, under RSA 91-8:3, comma, Roman 2, parentheses, small b, the hiring of any person as a public employee, followed by session 2, RSA 91-8:3, paragraph Roman 2, parentheses c, matters which, if discussed in public, would likely affect adversely the reputation of any person other than a member of the body or the agency itself.
I'll second that. Would you do roll call, please, me?
Commissioner Babson?
Yes.
Commissioner Bevard?
Yes.
Commissioner McCarthy?
Yes.
Go ahead and make your motion.
I did. Oh, I make a motion, we come out of non-public.
Second.
All those in favor say aye.
Aye.
Aye. We're out in non-public. And I'd like to announce that we hired, you got her?
Vicki Croce.
Vicki Croce as an LNA, part-time on the first shift. And I think we're doing very well with the hires at the nursing homes. So. Are there any media questions? Yes, sir. You had.
That's not really an immediate question. I have to speak to what Commissioner Babson had said about the right to know requests and the cost for retrieval. That LSR was put in many different times, and both the committees and the House voted to not go through with charging the requester retrieval fees. And I do want to remind you, first I have to say on a positive note, I use you as commissioners as an example of how to move in and out of non-public. So that's a good accomplishment. But to charge fees to someone to retrieve information flies in the face of transparency. New Hampshire has a D- when it comes to right to know requests and transparency. That is not going to get any better if you charge people and chill the ability for people to get information. If you are getting hundreds of right to know requests, the question you should ask is, why are you getting so many requests? And I'm certain that would be an issue. But I don't know how many you're getting. You're getting 5, 10? What do you, what's the amount?
It's 16 in one day.
I know, but that's 16 separate ones.
Mm-hmm.
I think you should just investigate that more before you just jump to the legislature.
Madam Chairman, may I respond to
Yes,
a good
David?
representative?
Yes.
I believe I said it, we can check the film back when we started this discussion earlier today, something about that my vision is to have relief from the court say
Thank you.
that enough's enough of this stuff. You haven't seen what we've gotten, but we don't have the time to, I said, I thought in lieu of paying, because I agree with you. If you have people pay, they're not gonna come in and ask. We already have a charge of, what, 50 cents if you, well, the courts and you folks have said 50 cents to print stuff out is okay. But, and I thought I said no, in lieu of that, some relief from the court, because we don't have the time or the resources to chase the stuff that we have been asked to chase this week. I mean, you don't know what it is, but believe me, it's more than 30 seconds worth.
May I go on? My comment would be, there is a process for you to at least have the court intervene if somebody is being a vexatious litigant. But by simply asking for common information that you should be able to retrieve easily, if you're not being able to retrieve, then that's a whole nother issue. Years ago, if you remember, Commissioner Babson, DocStar came in.
Yep.
DocStar was a company that would basically make everything electronic, and you could just push a button, make something, make a non-public, non-accessible.
You can retrieve anything.
And I believe the price was like $30,000 to do all of your documentation.
Yeah.
And I know in the nursing home, you're already using electronic data stuff. So I'm just saying, you're moving in a good direction, but I don't think the legislature making people charge is going to stop the issue. I think you may have
I didn't say that, I just said I corrected that and said to you, in lieu of that, there ought to be some way we could go to the court and say, I mean, if you could see what we've been asked to get at, it's hugely time consuming, and anybody sitting there would scratch their head and say, why does this person need it? And I'm not saying charge anybody to do it. I'm saying it some way that there's a paragraph in 91A that offers relief to the, call them the defendants in this case, to stop this, get to the point where it's almost harassment. I hate to say it, but that's my feeling. I'm not saying charge the person to come in.
One last point on that is, this is why I believe I said last time or a few meetings ago that you should review your 91A policy, because because there are things that you don't have to do if somebody requests information.
Right.
So maybe you need to review that policy, because you're not technically supposed to be compiling information and collating information. The law is specific. The information has to be available. So if the answer is, yes, we have that information for you, it's in the business office in this binder, that's transparency right there.
Right.
So I hope you're not compiling like Excel spreadsheet reports. I mean, unless you're in a lawsuit, you don't have to do that. But if it's just a simple request for information, you should be able to retrieve it easily. That's why I don't understand what the problem is.
Well, and can I just add something really quick?
Yes, Ken?
Once we get it in, I sent out a letter that we received a 91A request, thank you. But all of it is not all of it's not even public record. So we got to go through the whole thing is to make sure that there's no public record intertwined with this information. Because that's all they're entitled to is a public record.
Correct.
Not someone's thoughts of or other items that aren't public. And these are documents that should have been presented to the Board of Commissioners that would make them public. So we have to go through them all and review them before.
Yeah, but your policy should address that. If you need to send certain things through an attorney to make sure that you're not giving away information that would upset a case, an ongoing case or something, or if a case has not been adjudicated, you can't give it out. So, but I'm just saying, review your policy. So when was the last time the commissioners actually had the New Hampshire Municipal Association 91A update? Because it's been updated several times. If you haven't had it this year, you should, because they changed 91A again.
I believe you made sure each of us had a copy of that this year.
but they put on a training, an actual training where you can go back and forth and ask a lot of these questions.
Maybe we had it in 2016 here.
I think it's time we might have it again.
I believe several towns in this area need to have a refresher course,
Some more than others.
yes. So don't always think the legislature is gonna fix your problem, that doesn't always happen. Thank you.
Okay, I'll wait for a motion to adjourn.
Make a motion, we adjourn.
I will second.
All those in favor say aye.
Aye.
Aye.